6:30 p.m.
Na mtazamaji, tunakujia mubashara kabisa. Tumechukua mapumziko mafupi tukikujia mubashara kutoka uwanja huu wa Kapkatet, kaunti ya Kericho, shughuli nzima ikiwa ni kuangazia mpango wa afya kwa wote, na kumekwepo na mazungumzo kuhusiana na mpango wa afya ambao ulizinduliwa na Rais William Ruto wakati ambapo alikuwa akiwa tarehe 25 mwezi uliopita akiwapa wale wahudumu wa afya ya jamii vifaa 1,100 kwenda katika kaunti 47. Na kwetu ananiita Joashon Sare, siko peke yangu, mwenzangu yuko katika upande hapa nilipo.
Naam, shukran bwana Onsare. Kwa kweli imekuwa ni siku mbili ambapo tumeweza kushuhudia mazungumzo kwa kina, washikadau mbalimbali katika sekta ya afya wote wakikongamana hapa. Kumbuka hii ni baadhi ya matayarisho kabla ya siku kuu ambayo ni siku ya mashujaa tarehe 20 Ijumaa hii ijayo. Wananchi wote wanakaribishwa katika kaunti hii ya Kericho ambayo mwaka huu imepata nafasi ya kuwa kaunti ambayo inaadhimisha ama ambapo sherehe hizi kuu za mashujaa zitakuwa zikiadhimishwa. Lakini la mno ni swala au mjadala mkuu katika maadhimisho ya mashujaa mwaka huu ikiwa ni swala la afya, haswa katika ule mpango wa afya kwa wote au kwa lugha ya kimombo the universal health care. Na ni swala ambapo washikadau wameweza kukongamana kwa zaidi ya wiki moja, angalau waweze kuangazia, kutathmini na pia kudadisi ni vipi ambavyo ajenda hii itasongeshwa mbele. Ukikumbuka kwamba wakati wa kampeni za mwaka jana, mwaka 2022, katika au miongoni mwa baadhi ya manifesto ya serikali ya Kenya Kwanza, wakati huo ikiwa ni mrengo wa Kenya Kwanza, ilikuwa kuhakikisha kwamba mpango huu wa afya kwa wote umeweza kuwanufaisha wananchi wote kote nchini. Na njia moja wapo ni kule kusambazwa kwa vifaa kwa wale wahudumu wa afya wa kujitolea au wale wahudumu wa afya wa kijamii. Na hivyo jana tulimwona naibu wa rais Rigathi Gachagua akizuru kaunti hii ya Kericho kuona ni vipi wanatumia vifaa hivi.
Bila shaka Muige ushanena, na ni kweli kwamba kuna mengi ambayo yanafanywa na tumeweza kushuhudia hayo ambayo yanafanywa, mojawapo likiwa umesema swala la kutathmini. Vile kuna swala la kuhamasisha jamii. Na huu mpango uko vipi na wanajua kipi kuhusiana na mpango wa afya kwa wote? Usisahau kwamba bwana Muige, tumekuwa tukizungumzia swala hili si mara moja. Serikali iliyopita iliweza kuzindua awamu ya kwanza na awamu ya pili ya majaribio tu ya huduma za afya kwa wote. Na hii itakuwa ni awamu ya tatu. Ulivyosema awali kwamba Rais William Ruto atakuwa katika kaunti ya Kericho katika uwanja wa Green Stadium katikati mwa mji wa Kericho kuweza kuzindua awamu nyingine ya mpango wa afya kwa wote. Na bwana Muige, siku ya leo ndio tumeweza kuona kwamba kuna mengi ambayo yanazungumziwa. Hivi sasa tunazungumzia masuala ya teknolojia,
kidijitali.
Ndio bwana, ndio mambo ambayo yanaangaziwa, na tumeweza kupita katika vituo mbalimbali kuweza kuangalia hali iko vipi. Tumeona kuna watu ambao wanatumia zile applications, programu ambazo zinatoa huduma za afya kwa njia ya kidijitali kabisa. Iwapo wewe ni mgonjwa, unatuma ujumbe, alafu kishatuma ujumbe unaweza kupewa nafasi katika hospitali fulani, zile hospitali ambazo ziko karibu. Na uliweza kuzungumza na wadau.
Kwa kweli niliweza kuzungumza na wadau hawa, lakini ni vyema kwamba kwanza tumfahamishe mtazamaji wa TV47. Kwa sasa tumeweza kumuona katibu katika masuala ya mawasiliano ambaye ni Kisiang'ani, tayari ameweza kufika hapa katika uwanja huu wa Kapkatet kuangazia na pia kutazama ni yepi ambayo yanajiri. Na pia tumeweza kumuona gavana wa Murang'a ambaye ni Rongo Kang'ata, pia ameweza kufika leo. Kumbuka siku ya leo majadiliano ambayo tunaweza kushuhudia au masuala ambayo yanaweza kutukia ni swala ambapo washikadau hawa watakuwa wakizungumzia ni masuala ya kidijitali. Na washikadau hawa ukimwona katibu Kisiang'ani, inamaanisha kwamba masuala haya yatakuwa teknolojia yapo na yatakuwa kizungumziwa kwa kina. Kama ulivyosema kwamba awali niliweza kutangamana na baadhi ya washikadau hawa. Na kwa kweli Onsare,
mambo yamenoga.
mambo yamenoga. Wakenya na teknolojia, nimeona mengi. Mwanzo nimeona, kunradhi mtazamaji, ni baadhi tu ambayo hali ya kawaida, kazi tu ndivyo ambavyo inavyotokea tunapopeperusha taarifa hizo, matangazo moja kwa moja. Naam, Onsari, nimeweza kuona kuna baadhi ya washikadau nimeweza kuzungumza nao. Jambo moja kunradhi ambayo nimeweza kuona ni kwamba wajua unaweza kuzungumza na daktari au mhudumu wa afya kupitia simu ya rununu. Programu tu. Unampigia simu, mnaweza kuongea, kuna ile kwa lugha ya kimombo video calling. Yeye anakuona, unaweza muona, anaweza kupa mawaidha pia baada ya kupata maelezo unajihisi vipi. Hii yote ni kutumia teknolojia. Kuna mshikadau mwingine ambaye tumeweza kuongea naye kwamba kuna ile tunaita virtual clinic. Kifaa au chombo kinakuja karibu nawe, kinawekwa pale, unakaguliwa, unaingia, unakaguliwa, daktari hayupo. Lakini kupitia tarakilishi au programu kama vilivyotaja wewe, kuna vile unaweza fanya mazungumzo naye. Moja kwa moja. Ukifanya mazungumzo naye, anaweza kuambia kulingana na maelezo ambayo umenipa, unahitaji dawa hii na nenda kanunue dawa hii, au kama unahitaji vipimo zaidi, anaweza kuelezea hapa siwezi kusaidia zaidi, lakini unahitaji vipimo zaidi ili kudadisi ni swala lipi hilo ambalo linakutatiza kiafya. Washikadau wengine ambao tumeweza kuzungumza nao ni kwamba kuna vifaa ambavyo kama unataka kupima joto au vile moyo wako unavyopiga, kuna vifaa vya kidijitali. Wale wahudumu wa afya kujitolea au wa kijamii wanaweza kuwa wakitembea navyo. Kumbuka serikali ilisambaza vifaa hivi, na vifaa hivi vinatuma data moja kwa moja hadi mahali daktari yupo, na utapata maelezo zaidi kutoka kwa daktari kwambia utafanya hivi kaka Onsare, utatoka hapa, kimbia dukani, utapata dawa hii, au unahitaji vipimo zaidi ili tuweze. Bila shaka ni baadhi tu ya wale ambao wanatoa hizo huduma. Shukrani sana Bwana Moige. Na mtazamaji, kwa faida yako, ni matangazo ambayo tunakupeperushia mubashara kutoka uwanja huu wa Kapkatet katika kaunti ya Kericho, nikiwa na mwenzangu Moige William, na vile vile kuna kikosi kizima ambacho kiko hapa. Tumeweza kupiga kambi kuanzia hapo jana na tutaendelea hadi siku ya Ijumaa, siku ambayo ni kilele cha sherehe za mashujaa. Haya tu ni maandalizi tunaendelea kufanya, katika lugha ya kimombo wanasema build up to the main event, ambapo tunafanya hiyo shughuli kwa kina zaidi. Onsare wajua kimombo. Asante. Mtazamaji, ndo shughuli mpevu kabisa ambayo tunakushirikisha, na hivi sasa kumekuwepo na mazungumzo kuhusiana na afya kwa njia ya kidijitali, ambayo ni swala ambalo limeibuka kwa sababu tuko kwenye karne ambayo imekumbatia teknolojia, ili kuweza kuhakikisha huduma hizi zinarahisishwa, isije tukangoja sana kwamba tunatumia zile mbinu za kitambo kuweza mgonjwa kuweza kupata huduma. Hivi sasa mambo dijitali. Na mtazamaji, tukizungumzia mpango wa afya nyumbani, ama ukipenda mpango wa afya kwa wote, utapata kwamba kuna mengi tu ambao yamehusishwa katika mpango huu. Kuna wale wahudumu wa afya wa jamii, na tunapozungumzia wahudumu wa afya ya jamii, ni ile afya ya msingi kabisa ambayo unafaa kuipata, na vituo ambao vinashirikisha shughuli nzima ni zile zahanati za kiwango cha 2, cha 3, ili kuweza kuhakikisha jamii nzima hamna kila ambacho kinaathiri. Na Bwana Moige, ni vyema sana mtazamaji wetu aweze kufahamu kwamba afya ni swala ambalo linatuhusu kwa njia moja au nyingine. Iwapo mwili wako haufanyi kazi vizuri, basi utafanya kingine? Hamna. Inakuwa ngumu. Na ni swala ambalo tumeweza kuliona, na wadau wengi wameweza kufika hapa, mashirika ya kimataifa ambayo yanaangazia masuala ya afya, wale wafadhili ambao wamefika hapa ili kuweza kutoa suluhu ya namna afya itakuwa bora zaidi. Na ndiposa labda turejelee maneno yake Naibu Rais Rigathi Gachagua alipokuwa akihutubia washikadau hapo jana. Kumbuka alikuwa hapa jana akiwahutubia washikadau katika sekta ya afya. Alisisitiza kwamba taifa lenye watu wenye afya bora ni taifa ambalo linakuwa kwa kasi. Na kama ulivyosema, ni vyema wa Kenya mara kwa mara wanakuwa na yale mazoea ya kuhakikisha kwamba wamefika zahanatini au wamefika kumwona tabibu, angalau kujua hali yao iko vipi. Lakini kuna jambo muhimu ambalo umetaja, swala la wale wahudumu wa afya wa kujitolea au wa kijamii. Na ni jambo ambalo limetiliwa mkazo sana na serikali ya Kenya Kwanza, haswa Wizara ya Afya. Na kupewa kwa vifaa kwa wahudumu hao wa afya, wengi kulikuwa na maswali ibuka ambayo yalibuka. Kulikuwa na hisia kinzani, hisia mseto kuhusiana hawa watu wanajua kuvitumia. Wamehitimu kweli kuwa wanavitumia. Lakini kulingana na Wizara ya Afya ni kwamba hawa wote maafisa wahudumu wa afya kujitolea kwamba wamepitia mafunzo
kiwango fulani
wanaweza kutumia vifaa hivi. Lakini la mno, baadhi ya
majukumu ambayo wanayatekeleza si yale ambayo yanahitaji utaalamu mno. Lakini unaweza kuiona ni mambo madogo lakini makubwa. Mojawapo ya majukumu ya wahudumu wa afya ni kama lile swala la kuweza kufika nyumbani kwako. Kumbuka mhudumu mmoja wa afya kujitolea ana takriban nyumba 100 za kuweza kufika na kuweza kuangalia afya iko vipi.
Naam. Lakini yake ni miongoni kama kutoa ile dawa ya minyoo,
kuangalia joto mwilini, uzani. Mambo rahisi lakini muhimu sana. Na mtazamaji, ndo shughuli pevu kabisa ambayo tunazidi kukupeperushia kutoka uwanja wa Kapkatet hapa katika kaunti ya Kericho, nikiwa na mwenzangu Moige William, ambapo tunazidi tu kukupa ni yepi ambayo yanajiri na ni yepi ambayo tunayatarajia katika muda usiokuwa mrefu, ili tuweze kujua ni kipi kinaendelea.
Naam, Onsare, kwa sasa naarifiwa kwamba tuweze kuvuka upande ule mwingine ambapo kuna maonyesho mbalimbali ambayo yanaendelea. Mwenzetu Sheila Chelagat ako upande ule, tumrushie usukani kwako Sheila.
Right, this is the stand for the Ministry of Health, and they are advocating for Breast Cancer Awareness Month. And yes, right, we have the PS Health for medical and professional standards, Madam Mary Muthoni, also present at this booth, which is representing the Ministry of Health, and they are advocating for the Breast Cancer Awareness Month. We have the Murang'a Governor Irungu Kang'ata, the PSICT, Broadcast and Telecommunications, Edward Kisiang'ani, Governor Elgeyo Marakwet Wesley Rotich, who we know is spearheading the ICT committee at the Council of Governors. Also present here, we have some Kenya medical and practitioners and dentist union officials here, just taking a look around what is happening at the various exhibition points here at this UHC conference that is happening before we get to the Mashujaa Day celebrations. And right about now we have Murang'a Governor Irungu Kang'ata. Welcome to TV47. Probably we are looking at digital health innovation and solutions. What do you have to say about that?
Yes, Murang'a, we are doing our best to digitize our health records. We were the first county to introduce a software that is called Afya KE in our level 5 hospital, Murang'a town. Through it, we are able to monitor the number of patients going to our facility, track medicine, track other functionalities in a hospital. God willing, within the next 2 months, we shall cascade that software to the entire 157 health facilities in Murang'a County. And that way, the problem of patients' records getting lost, the problem of people stealing medicine, our inability to track stock levels of our medicine will be a thing of the past.
And probably, what is Murang'a County doing in terms of medical research and innovation? Are you partnering with some of these health facilities and probably medical institutions and institutes to ensure that there is innovation within Murang'a County?
University of Aga Khan is a partner entity. We allow them to bring their students in Murang'a and do research, and they need also to share the research findings with us. But now that Murang'a is the first county to automate its level 4 hospital, we are able to now get data which can be used for research. I have no doubt once we roll out that program in all our health facilities, we'll be able to harvest a lot of research data. Also, Murang'a started something called Kangata Care, which is a partnership between Murang'a County and NHIF. Through it, the people, the indigents, the poor, the vulnerable, are onboarded for free. Then they get certain unique services from NHIF. That Kangata Care has been adopted by other counties, including Kiambu, Trans Nzoia, and I think that has been a good research on how universal healthcare system can work in the entire Republic of Kenya.
Probably last question, we have seen that there was the launch of the community health volunteers. What is the progress in Murang'a County? Is there a difference in terms of the preventative and promotive healthcare setting? Is it reaching the grassroots level?
Yes, their main role, what they have achieved in Murang'a mainly is to help us mobilize more people to join Kangata Care. Last financial year, we paid for 20,000 households. Imagining one household has about 4 persons, so we covered 80,000 Murang'a residents. This year, we have multiplied that number twice into 40,000 households. If one household has 4 persons, then you're talking about 160,000 people benefiting out of the new Kangata Care. To get those numbers, we used CHV, and therefore for us, it was something that is very positive.
Thank you very much. We appreciate. That has been Murang'a Governor Irungu Kangata, and now we will be moving on to see what other, exhibitions have been set here at the Kapkatet grounds in Kericho County, and we have the presence of even other governors from Elgeyo Marakwet. We have Wesley Rotich in charge of ICT at the Cabinet, at the Council of Governors. Also, we have seen presence of Kenya Medical and Practitioners Dentist Union officials here at the Kapkatet grounds, just taking a look at some of the exhibitions that are ongoing here. Right now, they are looking at Damu KE exhibition. And it's all about, blood donations, what can be donated, what organs can be donated in order to save lives. We're looking at universal healthcare coverage and ensuring that there is accessible healthcare and quality healthcare for each and every person in the country, and ensuring that it reaches the community level, ensures that it reaches every Kenyan. Right now, we are having a presentation by some of participants and from the gift of life. It's a blood donation initiative. We will probably be looking at who can donate blood, what donors, who can be a donor, who will receive what blood from whoever. So let us probably have the PS talk to us. How are you?
Naleta PS mwingine.
How are you?
I'm fine, thank you.
This is day 2, and we are talking about today digital health solutions and innovation. Probably in terms of now blood donation, how far can going digital help us with that?
Digitization is one of the key areas that we are focusing on as a ministry, and starting from even what you're talking about, the community health promoters, even taking of the blood, interconnecting our hospitals and health facilities. Really, it will go a long way for Kenyans, because it is making and ensuring that things are becoming easier, accessible, available, and because the chief guest is here, I think I will leave him to say something.
Yes, so thank you. We are having the PS Edward Kisiang'ani. Tell us, how far are we in terms of digitizing the health system in Kenya?
I think we are making a lot of progress, because with the hotspots, the fiber optic layout, I think a lot of health institutions are now going to be on the digital platform. In terms of percentages, in some places, in hotspots, we are a bit low, but we have, once we laid 100,000 kilometers of fiber in the next 5 years, we shall advance almost 100 times where we are now. And once we put the 25,000 hotspots, again, we shall go up by about 50%. I think in the next 5 years, this country will be great in terms of digitization of our health services. Yes.
We are looking at probably give us a breakdown. What counties and what other counties, how many counties so far have already embraced digitization of the health system?
I think the directive that all counties have, there are different levels of laying the infrastructure, but in terms of adopting the idea and accepting the idea, it's a government policy that digitization takes place. There are certain services which are not manual, and when you check at all our county headquarters, most of them have the fiber. So in terms of fiber connectivity and the communication, all counties.
Okay.
Yes.
And probably last question is that are you partnering with some of the medical research centers in terms of ensuring that at least we have walked around in some of the exhibitions, and we're looking that they're embracing virtual reality. Probably is the ministry looking forward to some of such partnerships?
Healthcare is not a preserve of one person or just government alone. Private sector is playing a role. UN organizations, including the World Health Organization, are also playing a role. Government is playing its own role. So it's a comprehensive plan to bring everybody on board, because healthcare for all is good for our country. Yes.
Thank you very much. That has been the PSICT, Edward Kisiang'ani. Let's probably have Governor Wesley Korir. Hello, Mr. Governor. Talk to us. We are talking about digitizing the health systems. How about mashinani? Kuko vipi?
Thank you very much. I want to say, first and foremost, I want to appreciate the President for his resolve and for his bold step to actually overhaul the health system in Kenya. As the chair of ICT at the Council of Governors, I think we have no choice but to go through this process of digitization of health services, and this is the reason. In Kenya now, if you want to go to the hospital, you will be treated, and the next time you get sick and go to another hospital, there is no record about you. There is nothing to show that you were sick at some point and what you are ailing from and what disease you are ailing from and what drugs were prescribed. So whatever we are doing in digital health is that we need to have a record of you, that we put in your patient records. It can populate anywhere in Kenya, and the doctor who is treating you can easily know what you are going through. The same thing is, it will help us to do telemedicine. We don't have enough money to actually employ, every county to employ a consultant. With telemedicine, and through this, we can be able to give a doctor in KNH or MTRH or KU National Hospital credentials, open your system, check your diagnostics, and then recommend you for treatment or a certain treatment.
And how far have you come in Elgeyo Marakwet?
In Elgeyo Marakwet, what I've done, number one is actually I've digitized my main hospital, that is the referral hospital. I'm now digitizing 7 sub-county hospitals, which is ongoing, and I want to go towards 20 model health centers and eventually roll it out to 128 facilities. currently we are somewhere, and of course with the CHVs, we are going to do much together, and with the gadgets that the CHVs have, we will actually ensure that we do primary health care, but digitally, and have records of all our people. So I can tell you the next level that we are doing, finally on digitization, is that it will give us trends of diseases in every area. When you digitize, I will know there is probably prevalence of certain disease in an area, so we will not be intervening generally. We will be intervening specifically and saving resources instead of just as we will be knowing pneumonia is very rampant in this area, TB is rampant in this area, certain upsurge of a certain disease in this area. So interventions will be targeted and will actually be saving resources. So digitization is the way to go. We will also be using artificial intelligence to assess and to know what are some of the big challenges that we have as a country. And it will be showing, even in my county, it will be showing a certain small area has a certain problem. So I think it's the way to go. And
probably last question, Bwana Governor, what about the financing and the resources? Do we have that for ensuring that we digitize the whole healthcare system?
Yeah, the reason why we want it to be centralized this time is that every county, like for example myself as governor in Elgeyo Marakwet, I am doing my own small way digitization. Another county is doing their own. So what we said, why don't we have, as the chair of ICT, I was among those proponents who said, why don't we look for one platform? Just like a bank, like Equity Bank, KCB, they have one platform in Nairobi, and then all of us can be branches, and we can, not necessarily to monitor, but every one of us can utilize that system, so that eventually we are not procuring 47 systems. We have one system, cheaper to operate, it is standardized. When we are feeding into the Kenya National KDHS health information system, we get statistics in a uniform manner. We can easily get our maybe our indicators. We can know if we are making progress or if we are going backwards. So if we have a uniform system, it becomes very easy for us. So digitization is the way to go. You can imagine if a bank is not digitized, how will you know a patient or a customer in Kericho, how they are doing? So whatever we are doing it's not in Kenya, it's not only that we are starting here, it happens all over the world. These are the main countries. There are some countries which actually have digitized their medical records, and they can even know how many patients do they have in diabetes. Kenyans don't even know what they are ailing from. So this time around, we want every Kenyan to be conscious of their health. And if they are not, at least the system can remember that so and so is a diabetic patient. When the doctor sees your profile, he knows that this is a diabetic patient and is currently on this medication. Why is he not getting treatment well? Maybe I can change the medication. So the doctor will be helping you from a point of view. It can also help research which medication works, which does not work. So it's going to be very easy for doctors, for research institutions, for universities to actually do, because digitization will have a database. If you go to hospitals now, you will never get a space, because how we keep our records. Even if you were to retrieve your medical records today, it is better to go back to the CT scan, better to the lab, go back to the lab, all those, because you don't have a database which can be retrieved with a click of a button.
But now the question that many would ask is, what about digital literacy? Yes, you're talking about we are digitizing the process, and now I am probably having a shosho in the village. What about the education and giving them literacy?
You don't, for example, when you go to the bank, I was a banker myself. When you go to the bank, for example, Equity Bank uses Pinnacle 10, for example. No customer even knows what kind of system that Equity Bank uses. The only thing they want to know is their balances, and they go home. If they verify it's correct, they go home. Even for a shosho who comes for treatment, it's only fair to have our records ready, so that when she comes back to the hospital, she's not being taken in rounds to go for queues to start everything. It is not too much into the patient in terms of having information. It is for the service providers to be able to serve the patients well. So I know, of course, we still have illiteracy, but I can tell you, this thing still helps, just like an ID system, integrated personal registration system. It is there, but even me as a layman who has an ID, I don't know what happens there. But the end result and the service that I get as I'm given by the ID is much better. So we are saying it is better to have this system. It will really support us. It will help Kenyans, and it's going to be a revolution. And as the chair of ICT, I participated in this process, and I want to tell Kenyans this is the way to go, so that we can be able to have a good Kenya. We have to change this Kenya, and we have no choice. Our people have suffered for so many years. It is time they have a better life.
Asante sana Bwana Governor. That has been Wesley Korir, the governor for Elgeyo Marakwet, who has just spoken about, he also spearheads the committee of ICT at the Council of Governors, and therefore he has also spoken about just some of the financial and resources and what have they done as the Governors Council in ensuring that Kenya digitizes their healthcare system. And so exhibitions continue here at the Kapkatet grounds. We can see that today we have had right about before these exhibitions where that have been graced by the chief guest who is the PS ICT Broadcast and Communications, Dr. Edward Kisiang'ani. Just before that, we have had the plenary discussions where we have seen just the journey of a patient as well as healthcare providers. What is their perspectives in terms of digitization? What are some of the lessons learned in this quest to digitize healthcare systems in Kenya? What are some of the lessons that have been learned, and what do we need to do as we forge forward? Right about now, we are at the Kenya University Teaching Referral and Research Hospital exhibition tent. They're just looking at some of the technologies that have emerged, what is being used in order to fight some of these diseases and improve the healthcare access in Kenya. We will be looking at some of the universal health, how can we deliver the universal healthcare coverage yes, in Kenya, and how some of the stakeholders are participating in the active and ensuring that there is universal healthcare coverage. Right about now, we have, as you can see on your screen, the PSICT, who is the chief guest of this occasion. Also, next to him is Olive Mugenda, Dr. Olive Mugenda, who we know, Professor Olive Mugenda, I beg your pardon, who we know is a pioneer for this Kenyatta University Teaching and Referral and Research Hospital. She is one woman who has really pioneered in ensuring pioneered in the creation of this facility that has since now has really been quite a stone in ensuring that we have quality healthcare. So we will be looking forward to have the chief guest, who is ICTPS, Edward Kisiang'ani, just speaking about how the Ministry of improving in terms of delivering universal healthcare coverage through digitization. Just how did we get here as a country? Yesterday we saw that there was the community health volunteers. It is almost what we would call an army of, these health promoters that are ensuring that at the grassroots level we have quality access to healthcare and that there is preventative and promotive healthcare for Kenyans at the grassroots and community level. The ICT, Dr. Edward Kisiang'ani will be delivering the speech that we were expecting from Cabinet Secretary ICT Edward Owalo, Eliud Owalo, I beg your pardon, and we will just be looking at the evolution of health data, because now with this digitization we see that a patient will be getting to hospital, their records will be taken, and then now through the digitization we are going paperless, meaning that through the digitization, regardless of what hospital a patient goes, his or her records will be retrievable from the system that has been spearheaded by the Ministry of ICT. We will be looking at now this health data. Once it is collected, what happens to this data? How does the data that has been collected help the national government as well as the county government in ensuring that we can preventative care for some of the diseases that are prone to some areas, and probably in terms of preventing some epidemics in the community level. This program, the digital We had the scale up. The scale up is continuing in the country. It has been done in phases, which started with Kisumu County, whereby some sub-counties such as Muhoroni, Nyakach, Nyando, Kisumu, East sub-counties, and right about now 75% of Kisumu have been partially digitized, and we are expecting to see that this program, which started at Kisumu County, now spans out to the entire country and ensure that we have fully digitized at least by the year 2030. This has been reckoned as one way that will greatly improve the quality of data we receive and improve the health status of the population. Now, with this app, with this digitization, we will see that one can use input data from their household visits and also track the stock of essential commodities, making it more accurate. We have had the complaints of medical facilities. People say that when you go to hospital, try and get drugs, you find that sometimes you do not get the drugs, and just outside in some of the chemists that are outside, you find that there's those drugs. So therefore, with this digitization, it will make it easier for the stocking, the record keeping of the stocks that are there, and making it more accurate for the health system. And it will definitely, with this digitization, we will see that there will be an eased workload in terms of compiling reports. This has been seen as a way that will enable accountability and ensure that there is 100% completeness of data and verification. And now with this system, there will be real-time data being taken, and it enables timely data-driven decision making. With real-time, it means now once data is taken, a patient can therefore see that they are ailing from something, they are diagnosed, and with that, immediately they are sent to either the laboratories or the pharmacies, and there would be real-time, in terms of getting them to get the medication that they require. With this system as well, we look forward to seeing, informed policies and decision making in terms of if a county is more prone to diseases such as tuberculosis, then what can the county, according to the data that they are getting from this system, do in terms so that they can get probably preventative care for some of the people who are taking part in this healthcare system. Right about now, we are at the Moi and Teaching Referral Hospital exhibition tent, and we have just the PS ICT being taken through this system. How does it look like? We can see that you can input your status, what is the patient's name, what is the patient's age, the healthcare practitioner. We're looking at putting other details of the patient, and then from the patient, once the details are taken and registration is done, then you await triage and see, probably get your weight checked. You go to the doctor, where you get your prescription. You mention your some of what you are suffering from, and with that, it can be this system. It is fed directly to the pharmacy or either to the laboratory, and with that, there is enhanced record keeping and ensuring that we are getting quality access to quality healthcare access in the country. Right about now, we have Dr. Patrick Amo. Karibu sana, Daktari. This is TV 47. We are looking at the system, the digitization of this system. How will this system help us in ensuring that the county government or the national government has the right policies for its citizens?
This system is supposed to be able to take advantage of the different investments made by the national and county governments into one single platform for enhanced efficiency and effectiveness of delivery of healthcare services. For example, if you look at an institution like KEMSA, through this system we'll be able to have visibility from the dispensary level up to the national stores in Nairobi, the stock status of a particular medical commodity, and also at the national level, so that we can be able to make decisions in terms of forecasting, planning, and how we even procure.
And then we are also looking at it being a system that can help us, in terms of resource allocation. How will that play out we're looking at it coming as a system that will help in resource allocation. Then how will that be possible at the Ministry of Health?
Because we'll be able to have visibility of what is happening at the national level in terms of the number of cases, the disease burden, the distribution of the disease in the county level. Then through that, working with other partners, we can be able to jointly resource mobilize and put the investments into areas based on priorities that we have worked on.
And last question is, there has been significant positive successes being mentioned here, and probably just talk to us. What is your parting shot in terms of digitization? Is it the right step forward for Kenya?
My parting shot is that we have had missteps before. This time we have critically looked at how to deliver UHC, and we have taken a 360-degree look at the entire ecosystem, and we have taken the right decisions, and we believe through this investment, achievement of UHC will be a reality for Kenyans.
Thank you very much. That has been Dr. Patrick Amo. We continue to take a look at some of the exhibitions that are ongoing here at the Kapkatet grounds. Now remember that this conference is a precursor to the Mashujaa Day celebrations that will be held at the Kericho Green Stadium on Friday, where we expect President William Ruto to launch and unveil the universal healthcare coverage officially on that Mashujaa Day. We have the attendance of PS, ICT, Broadcast and Communication, Dr. Edward Kisiang'ani. As well, we have Murang'a Governor Irungu Kang'ata. We have Governor Wesley Rotich from Elgeyo Marakwet, him who is spearheading ICT at the Council of Governors. Also, we have PS, Medical Service and Professional Standards, Mary Mudhoni. We have the attendance of Olive Mogenda, who has been a pioneer in the creation of the Kenyatta Universal University Teaching and Research and Referral Hospital. And just right about now, just taking a look at some of the stands that are here at the Kapkatet grounds. Remember that today the theme of day 2 of this conference is digital health innovations and solutions. How far are we coming as a country in terms of ensuring that we deliver the universal health coverage through digitization? How did we get to digitization? What is our journey looking like? Because taking on such a task is really not as easy. It needs a lot of financial resource allocation and input. And with this, we are looking at the story of Kenyan health data in terms of, record keeping and digitization. Today we have also seen how we have evolved. Going from paper, we have had exhibitors saying that, for instance, during birth, a child would, probably be taken. Data will be taken, and you're given a birth notification. But now with this system, it means data will be taken. Yes, you will be given a notification. But now the Ministry of Health will be able to track this child as they grow, as they continue to grow. They can be able to take these records and see how, and evolve as the child grows, how they're faring on. This all will be, able to be stock taken, will be taken to ensure that, the healthcare of Kenyans at the community level is prioritized. We are looking at, what is the benefits of digitization. Some of the benefits that have been mentioned is that there will be able to be proper stock taking of some of the, medical resources that we see in our hospitals. In terms of, is it the medicine? When you go to hospital, will you be getting this medication? What about the expired medication? What happens to those medication? We'll be having to look at some of the equipment, stock taking, just how many equipment are functional, how many are not functional. And then there also is another advantage, which they say that one other benefit of this system is that a patient's record will be, taken right from birth to death, meaning that whatever happens to that patient, they can be able to track it and ensure that the records are well kept. And just not in some of the phases, some of the counties that have been taken to be in the pilot projects, but also this project is expected to be phased towards the entire country. We are looking at the Kenya Medical Teaching KMTC tent, where we are seeing students who have really put up their exhibitions and looking at what they're learning in class. And as you know, this is the future generation of some of our nurses and doctors, and so we're looking at what are they learning, how are they using technology in terms of in their day-to-day class activities, and ensuring that they are probably putting it to paper. It's not just about talking about digital. What are they doing in class about it? We will see how, as we continue, how the digitization of the health ecosystem is ongoing in the country. Right about now, we are looking at the PS ICT, taking a look at the Triba-U, which is an EMR system that ensures the patient journey is able to be seen. And we will be looking at how we can power, patient and primary healthcare through networks. This is the second day of the pre-conference that is happening on the UHC, the Universal Healthcare Coverage, here in Kapkatet grounds at Kericho County. We are looking at today the digitization of the healthcare system. The chief guest would have been Cabinet Secretary, Ministry of ICT, accompanied by Cabinet Secretary, Ministry of Industrialization and Trade, and also His Excellency the Governor, Elgeyo Marakwet, Wesley Rotich. And we have had, before this session, we have had a plenary where we have seen the patient's journey and the perspective of a healthcare provider. We are live with an official from KMTC. Probably, what is your institution doing as we go digital? How are you equipping your learners to ensure that they embrace digital?
I'm called Josiah Cheriot, KMTC chairperson. As KMTC, we are aligning ourselves to Kenya Kwanza objectives, and as we go along, we are starting to engage ourselves from the lecture halls, students to understand what is happening in terms of digitalization of activities, even at the community level. That's why we are having our staff training the people at the kata level, the lower level, so that they can also engage the community to understand what's supposed to be happening. So we are in it. We are working together with the government to actualize the creation of the Kenya Kwanza government. And
we are looking at your exhibition here. Probably just give us a brief. What have you exhibited for us?
We have several programs. I wish you could go around. We have physiotherapy. We have nutrition. We have all the programs that we are offering at KMTC. I don't know whether you'll get time. We walk around so that you can see physically what's happening.
Yes,
let's start from here. So kindly let me ask my colleague, Ms. Koech, to take us through the technical part of it. Thank you.
Thank you. Here, this is Kenya Medical Training College. We are showing how we manage fractures using skin traction. If somebody has a road accident and has a broken limb, or motorcycle and they have broken limb, when they are referred to the hospital, this is when now we come and reduce the fracture by immobilizing that limb, and we do skin traction, and then we maintain alignment so that now the fracture has been fixed and put in the same position until when it has united, the bone has reunited again.
Okay, let's have a quick round, a quick one, so that we can have an overview of what is happening.
Now, in case you lose your limb, in a road traffic accident, after we manage you, and then maybe there's a complication and your leg is cut, then now, later on when you are okay, we give you a limb so that you are able to function again. So we offer prosthesis, and this is made at Kenya Medical Training College.
Thank you. Probably one question that we are getting as even we continue the exhibition, how different is the training then and now?
There's a difference because now we are aligning with the modern technology. As the technology improves, even as we are improving in our teaching, because even we can teach virtually using the e-learning, and we can also incorporate the face-to-face classes. So we have virtual classes, and we are also having modern laboratories where we are able to teach our students, demonstrate to them to manage and practice in the lab before they go to the actual patient. By the time they are going there, they are perfect.
Okay, let's continue moving along. We see that the students do have a lot in exhibition. Probably what is going on here? We are looking at this. What is this?
What is going on here is that in case of an accident, there are those ones who may lose their breath and they are not able to breathe. So we are able to do CPR, we are able to do first aid and bring that person back to breathe. And if he's not able to breathe by doing the CPR, then now we go to intubation. We intubate and we monitor with the machine to see that the breathing has been established for a patient to be able to be managed well. Yes.
And probably as we continue, as my camera person just shows you what these students here have exhibited for us, we are at the dental care stand.
Yes.
Tell us.
Maybe you can give one of the students to demonstrate what they have learned.
Yes, that is very important. Hi, you are Jane. How are you? Oh, you're Jessica. How are you? You are at this stand. What have you learned? What is this that you're showing us today?
Here we are just working together with the multidisciplinary team in the community to identify those people who have lost their teeth and they are willing to restore them back. Yes.
How would you say, as you're learning now to be this, I'm sure this is what you want to do in future, as you're learning, how would you say is technology playing part in this?
It's playing a big role in the community because when you have teeth, your masticatory functions are good, aesthetics. Teeth is all about physical appearance, and even speech, the phonetics will be restored.
Great. We are seeing this is a sort of a monkey see, monkey do. We are seeing a lot about what these students are learning in class. Let us take a look. We are looking at machinery. I might not know what they really are for. Probably Winfred. Please do explain. What are these?
Okay, this is an trial box. This is an autoref. We use this one to examine the patient's eye. This one gives us precise power, where these one are lenses where we prescribe to the patient. Yeah.
Thank you. So when we're looking at the eye stuff, probably as you continue to learn, what would you say, how have you used technology in your learning career studies?
Okay, technology, for example, we measure a lot of patients compared to earlier, and like 1 hour we measure almost 100 people in the community.
Okay, thank you very much. This is Kenya's biggest medical training institute and institution here in Kenya, and as we walk along and hope to find the delegation that has the PS, one last word with you, Bwana Rotich. What is the importance of training as we get into digitization of the healthcare system?
The importance of training is that it enables the community to get close contacts with the health professionals. They'll be able to engage themselves. They'll be able to share information that is required of them. That is the beauty of it. Because we'll be having a lot of health workers integrated in the community, so a lot of people will not be expected to be at the hospital level because they will have been assisted at level 1. And that is where we are going.
Much. That has been the Kenya KMTC, the biggest medical training institution in the country, just telling us a bit about the importance of training even as we look forward to digitize the healthcare system. What about the learners that are in school? What are they getting as we move forward to digitizing the healthcare system? As you can see, the exhibitions continue. A lot of exhibitors here who just show us how technology has been merged into the healthcare system in order to, better the healthcare system and access to quality healthcare for even the Kenyan at the grassroots level. Let's move on. We are looking at PSICT. Dr. Edward Kisiang'ani, he is in charge of the broadcast and communication sector. The function is about to begin officially, where the CS Health is on our way. CS Susan Nahumicha is on her way here, as even we expound about digital innovations and the healthcare system in the country. We are at the KEMRI research. You know that this is really a pioneer in the research that is ongoing in Kenya about our medical situations, and we do know that research is really crucial in terms of ensuring that even as we fight some of these issues that patients and some of the diseases that are in the country, these people are critical in ensuring that we get the research first as we, plan to look at a better healthcare system. PSICT will be expected to deliver the speech from CS Eliud Owalo, who was expected to grace this occasion. We are looking at also how digital now technology is merging with healthcare sector. Let us look at this is the KEMRI stand. Let's just take a walk here. A lot of people have shown up and turned up here as even we look at covering the universal healthcare coverage in the country. Let's just take a look at what does KEMRI have for us. Hello, hi Grace. You are live on TV 47. Just tell us a little bit about how has KEMRI infused technology?
We've used the virtual reality kit to engage students so that they can be able to have an experience of our research lab. So we use the gadget. We have a video of our research labs where we are able to take it to schools, and students can be able to have a feel and see what a research lab looks like, and also meet with scientists.
And how different has that been in terms of now you're taking this to the student? How do they feel about it?
Oh, the students love it because it's very immersive, and they're able to feel as if they're in the research lab itself. Yeah.
What is the importance of research, even as we try to achieve universal healthcare coverage in Kenya? What is the importance of research?
So research is very important because it gives you answers to problems that we have. It's able to give evidence so that we're able to make good choices, and also based on the data that we get. So for us, we use this to entice students also into research, so that they're able to know what is there in terms of health research in Kenya.
And do you suppose maybe has the government embraced this technology in terms of ensuring that they invest in this research as a country and ensure that you have the funds and resources you require?
Yes, so for us, in fact, we are even scaling up to other research centers called This Is What We Do in Kilifi. So we are trying to scale up the schools engagement program to other research centers so that people can be able to know and learn and be able to get students to know what research is.
And probably how are we, aligning towards the global stage? Because, the world has really moved on in terms of embracing technology and healthcare. How far is Kenya in terms of that and research?
So for me, I wouldn't know the other part, but for us, we use the latest technology and we use it to our advantage so that we can be able to have a larger group or more students be able to learn and see what is there in terms of the latest technology. So that's why we are keen to use the virtual reality to engage with students.
Right, that is the Kemri exhibition tent here at the Kapkatet grounds in Kericho County, just telling us the importance of, medical research and how they're infusing technology and how are we coming along in aligning with some of the global trends that we see worldwide. Now we are at also Kemri. Duncan, how far are we in terms of aligning towards the global stage in terms of research? How far along is Kenya coming?
Yeah, so we've been able to advance globally, and what we are doing as a program, we are doing in terms of vaccine research and COVID research, and we are able to liaise with people. But as our program, we work with the AJFMRI, and we support 4 counties, and we are doing basically care treatment, HIV program. And one of the things that we are doing currently is to make sure that we are aligning ourselves to the national stage and ensuring that this data that we collect in a long run is being collected using equipment that we've been able to design and be able to support and put the data into the cloud. Yeah.
I'm looking around and I'm seeing that you have a program at South Rift Valley on HIV prevention. As we are gearing up towards the HIV Awareness Month, probably what is this program about and what does it entail?
Yeah, so ideally we are looking for people to ensure that they are negative and they stay negative. So that is why we are doing the prevention aspects. And one of the things is that we would want to really look at identifying people in the facility and in the community, and then we put them on treatment. Once they are on treatment, they will be able to give them drugs, and at the end of the day, their viral load will be able to come down and they will not be able to transmit to another sexual partner. Yeah.
And then we've seen reports of the possibility of a HIV cure. What would you say about that?
Yeah, that one is it's difficult at this particular point because we are doing what we call vaccine, and you see with vaccines it usually takes a longer time to be able to get a vaccine. So it's usually something that is in the far future, and it's because we are dealing with a virus, so handling viruses usually is a bit difficult. Yeah.
And HIV, this is now a global fight, and the world is aligning in finding a cure. How much have they incorporated Kenya in this fight?
Yeah, so Kenya is really in a good position when it comes to fighting HIV/AIDS, and this is actually cross-cutting across all the counties, and we have partners all over the counties in Kenya, and they are basically looking at ensuring that the HIV program is being actually handled well, and the American government has been able to give us drugs, and we've been able to give to our patients in the ground, and at the end of the day, we are hoping that this will reduce what we call the incident rates in Kenya. So once we reduce the incident rates, then eventually we are able to fight against HIV. The other critical component is that for the babies that are being born, we are putting the mothers into what we call the PMTCT program. Once we put them into the PMTCT program, our children that are born from HIV positive mothers will be negative at the end of the day.
And we see there's a lot of stigma around HIV, and people some do actually fear going to take some of this medication. Does the digital help in ensuring people who suffer, who are with this virus, can go get the medicine?
Yeah, so one of the we are ensuring that is that we are giving our clients messages that will improve in terms of reduce the stigma component. And then at the end of the day is that we are also sending them messages so that we can remind them to come to clinics. At the end of the day is to ensure that these clients are able to come for the clinic and adhere to their drugs and be able to support the other program. So in our digital space, we ensure that that is happening by sending them digital SMSs, and at the end of the day, they are going to be able to adhere to the messages that they are receiving. Yeah.
Thank you very much. Those are some of the sights and sounds here at this exhibition tent in Kericho County at the Kapkatet grounds. Just before we head to the main event, which will be the launching of the universal healthcare coverage in Kericho at the Kericho Green Stadium. We have had a lot of exhibitions, and right about now we are expecting that we would be joining the main tent as we go to, ensure that we'll take a look at how far Kenya has come in terms of digital innovations and research, and how far digital are we getting as a system, and how is it improving our healthcare system. We have with us the king of condoms.
The only one in Africa.
Probably why that name? As you take a look, truly he's the African king of condoms, and this is an initiative. Just talk to us about, it is about ending the triple threat, which is HIV.
Yes.
Now, why the king of condoms? Why did you take on this initiative?
Because condom is not talked about. Condom is a tool for them, not for us. And I thought of taking this brave initiative to champion condom in Africa. And I get a lot of support from NSDDCC that we work together. They provide condoms to us, and they also facilitate me to go to get people. I want to talk about this triple threat. We are having a lot of teeny pregnancy. We are having a lot of sexual gender violence, and you are getting a lot of HIV among youth. Just imagine, a week we are getting 98 new HIV infection among the youth. What can we do to stop? By the end of this week, 98 young people will be infected, and we are still sitting, talking, and doing nothing. So together we can make a difference. We can talk about HIV, we can talk about the impact of HIV/AIDS, and we need to walk around and talk. Yes.
So now you are the king of condom, and we are wondering, is there a queen here involved?
Queen. I have my queen here. Yes. Just the way the king, the London king, left his legacy to the queen. I want to leave my legacy to this young lady. I have nurtured her. She's from KU. Yes, this is a queen. I want to leave all my kingdom too.
Okay, how are you, Queen? Why take on this brave initiative?
Well, I like empowering the young people on how to protect themselves against HIV and AIDS. Yeah.
And now that you're the queen, probably people are wondering, how has it been so far for you as the queen of condoms?
So far, so good. I like my work. I like what I'm doing. Yeah.
Do you think we're actually succeeding in this fight against HIV?
Yes, we are succeeding, but sometimes we forgot we are in a battle. We are forgetting. We keep rising, then we go down. But we have challenge of resources. Like currently, we don't have condoms in our country. The taxation is very high on condom. If we can work on reducing the taxation, we can provide the young people the tools, because with or without us, sex is happening.
Quite a parting shot there from the king of condoms, and right now we see that the official event of the day 2 of this conference is just about to commence. We should be attention at this point because the national anthem is on. For me, back to you. Let us cross over to the live proceedings that are happening here at the Kapkatet grounds.
Please take your seat. Chief guests and all our distinguished guests, good afternoon. We are starting this session. My name is Dr. Langat, and I'll be calling upon Naomi. Please come forward and you give us the prayer. Naomi. So this is the session on digital health innovations and solutions. And we are very grateful that has been graced by representative of our CS MYCT.
Okay, let's pray. Our dear Heavenly loving Father, we've come before you this afternoon, Lord. We want to thank you. We want to glorify your name. Thank you for the visitors you brought to us today, Lord. As you are going to start this meeting, Lord, we pray so that you may be with us. Be with our government. As we are going to embark on our universal health coverage, Lord, we pray so that you may give them wisdom, so that we may uplift your people, Lord. Thank you so much, Jehovah. I ask you to be with us as we are going to start until the end, because that's our prayer. We pray, trusting and believing in our Lord Jesus Christ.
So please, Chair of Mashuchate's celebration, Mr. Dennis Itumbi, come forth and you manage the program. And for the colleagues who are still at the booths, we encourage you to move to the main stage so that we can engage in this conversation. Karibu Itumbi.
Thank you very much. Our chief guest, PS Broadcasting and Telecommunication, Professor Edward Kisiang'ani, Your Excellency Governors present, PSs, senior colleagues in government, and all of us, good afternoon. I encourage the ushers Kenya, please ask the people in the booths to close up and move for this session so that we can be able to do today's session here and move on. So kindly ushers, help us to usher people into the grounds so that we can start. Ladies and gentlemen, today is day 2 of the Universal Health Coverage Mashujaa Week exhibition. Chief guests, as you are well aware, the President and the Deputy President agreed to change the way we do our national holidays, and as part of that, each national holiday has a week before it where we focus on a theme. In December last year, we started with the digital economy and digital superhighway. During Mashujaa in Madaraka in Embu, we focused on SMEs, and this time around we are focusing on health. That is part of the changes that have been introduced into the celebration of our national holidays, and that is what we are doing here and now. For this conference, we are focusing on Afya Nyumbani, which is a bold and revolutionary way of delivering health. And that is why we have chosen these grounds at Kapkatet, because these grounds are historical in nature, where bold decisions are made, and it is therefore apt for making the decisions in the health sector. Having said that, we're going to have a very brief program. We're going to start with a key panel. The panel will be on digitization in health, the lessons learned, and forging ahead. The panel will be moderated by Ms. Caroline Njuguna of the East African Hub Director and County Director for Perth, Kenya. Ms. Caroline Njuguna, please. She'll be joined on stage by the PS Medical Services, Harry Kimtai, Excellency Irungu Kangata, the Governor of Murang'a County, who will take us through telemedicine and what it's doing for us. Please, Excellency Irungu Kangata, come on stage. Professor Olive Mugenda, Chairperson, Board of Directors, Kenyatta University Teaching, Referral and Research, who's doing a good job there. Dr. Sadifina Yenda, the Medical Superintendent, Shibwe Sub-County Hospital, Kakamega, to take us through the county experiences implementing a facility-wide system, the success, opportunities, and challenges. Mr. Thomas Onyango, who will take us on the lessons learned in co-financing with counties for the implementation of ICHIS as an integral component of domestic funding, best practices, and pitfalls to avoid. This panel was supposed to have more people, but we have consulted and decided to have the people picked to run us through this. So Ms. Caroline Njuguna, take us through this brief panel moment. Are we ready with the microphones and stuff? Okay. So we will have this and then we will guide on what next. Thank you very much.
Thank you so much, Mr. Itumbi. Ladies and gentlemen, esteemed participants, distinguished guests, all protocols observed, good afternoon. A very warm welcome to this thought-provoking and hopefully informative panel discussion. And it's an honor for me to moderate the discussion today as we embark on a journey of exploration and enlightenment into digitization of health with a focus on lessons learned and forging ahead. Allow me to sit down so that it becomes a very engaging session. And a warm welcome to our panelists. Allow me to set the scene a bit. Kenya's digital health odyssey is a story of innovation, challenges, and relentless determination. From the early days of recognizing the need of health information systems to the present, where we now have a country blueprint, a digital blueprint in the digital health superhighway, there is so much more to learn and share as we look into the future. As we embark on this exploration of Kenya's digital remarkable journey in harnessing technologies, we are joined by an esteemed panel, and they've been introduced by Itumbi, so allow me to just jump straight in the questions. I hope that's okay. All mics are working? Mic check? Okay.
1, 2.
1, 2.
Excellent. Let me start with you, PS Harry Kimtai. And I start with you because in any successful implementation of a countrywide initiative, the role of governance and leadership is pivotal. Could you elaborate on the role of ministry leadership and government leadership to make sure that this succeeds, the digital health initiatives succeed?
Thank you. I think the most critical point that you have raised is what is the role of the government in this whole space of digitization? One, without proper policies and strategies, together with a proper legal framework, it will be very difficult for any institution to achieve much in the digital era. And therefore, what the government is doing is coming up with a proper strategies and policies, together with the bills that we have now submitted to the two houses of parliament, so that we have an enabling environment so that those who want to invest in digitization are able to do it where it is clear. Two, we know what is the role of the private sector, what is the role of the government when it comes to digitization. In the health space, for example, we realize that each institution, each hospital was developing its own system. And these systems were all scattered all over across the facilities. What we are doing currently as a government is that we must have one policy, a policy that integrates allows for integration of all the systems to speak to each other so that we are able to work and deliver universal health care accordingly across the country, and we shall also be able to get data. As we talk of data, we must also ensure that we protect the information that is shared out there, because you realize that now there'll be a lot of sharing of information. So we must have the right policies, right laws, so that we're able to protect the information of the patients. So that's the role of the government, basically.
Thank you. Thank you, PS, for amplifying the role of policy. Before I let you go, I'm sure Wanjiko here or a healthcare worker is wondering, what is the so what of digital? Why does digitization of health become so important for the various stakeholders?
Digitization of health is very important at this age, because you realize that if you go to hospitals, there's been a lot of data capture which is done manually. It's been very cumbersome. It takes time to trace the records of the patient when they come for the second referral or second visit. So we want the patient to walk paperless within the hospital, and the records will be there. So that's why we want Wanjiko not to be carrying that book, that they have all their medical records. And when they go back home, sometimes they lose it when they move to different places. So we want the information of the patient to be in the hospital so that anytime the patient moves to the hospital, they're able to access their records. So digitization is key, and for Wanjiko, we have made it easy because we are going to have one identifying number that across any hospital they walk across, they will be identified uniquely, and therefore their records will be available. Thank you.
Thank you so much, PS, for that elaboration. Let me move to Governor Kang'ata, because we've heard from PS, the policies have been set. Service delivery happens at the sub-national level. And Murang'a County has been a trailblazer when it comes to digitization of health services. What motivated you to digitize public health facilities, and what impact have you seen so far?
Thank you so much. Allow me to give a context. We were elected on a certain platform, and we are implementing several social programs to try to pull the people of Murang'a out of poverty. That includes Kang'ata Care, which is basically what we call a scheme between Murang'a and HIF to give certain benefits to the people, to the poor, the subsidy program, some other support, let's say a free UG for ECD learners. But all that has to be funded. And I got a young computer scientist from the university. I told him, why can't we automate revenue and other processes to improve county income to be able to support all these programs we are running in Murang'a? So one day he was invited to a seminar like now this one. So when he attended, somebody told him Kitengela Hospital have automated hospital services. So he went. He came back and told me, there is no need for us to reinvent the wheel to do a software program for healthcare. Why can't we go and take that program, the software that is owned by the ministry, and we roll it out here? So we engaged the ministry. We were the first county referral hospital to engage the ministry to bring afia.ke to its own facility systems. Allow me to take this opportunity to thank very good scientists at the national level. I think Mr. Jared, he might be here, and his team. They really helped Murang'a to be able now to put that system from Nairobi to the first county referral system. Thank you.
Thank you for that. And you bring a really good, demonstration of collaboration between national government and county. Maybe a follow-on question. Was it a walk in the park? Were there any challenges when you are implementing these?
There were many challenges. Number one is the change culture. You are talking of health workers who have never interacted with digital systems. So you need to train them to what I can call a refresher course in computer skills, and also them to agree to stop manually, to do things manually. And you'd imagine there were loopholes which probably people were exploited to get something. And therefore, you need to convince them, how does automation help them and help the people of Murang'a? Secondly, is problems to do with automation. You need very strong network systems for you to support such kind of a program. You need also to bring what we call the hardware. You buy laptops, you buy various gadgets. Thirdly, you need a backup system that will also help you to continuously advise the computer scientists in Nairobi to change various facets of the system to fit the kind of situation you're having in Murang'a. Finally, there are serious networking issues. At times, the network that supports afia.ke is government-based. At times, you have a lot of downtime. And here you are dealing with lives of the people.
Yeah.
We were compelled to have a plan B. When the government network system is down, we switch to the private system so that you don't lose lives, because now people's lives are depending on this system. Thank you.
Thank you. And you bring out three key things that I want to reiterate. The critical role of change management, and I think that's a huge lesson, even as we embrace the digital health superhighway. You've spoken of backup, but also getting the basics right, infrastructure and connectivity. Thank you. Let me transition to Professor Mugenda, who was also my Vice Chancellor in my days at Kenyatta University. Good to have you on the panel. Now, Kenyatta University Teaching, Referral and Research Hospital has embarked on an ambitious journey to implement digital health solutions. The last I checked, it's one of the only public hospitals where you book online for an appointment, and many other initiatives. And you are the apex of leadership, of this great institute. Now, in implementation, what are the challenges that you faced when you had, to implement and really digitize that institution?
Thank you very much for that question. And talking about Kenyatta University Hospital, allow me to also acknowledge some of the people who are part of the vision, and many people may not know that our own chief guest today, Professor Kisiang'ani, was a professor in KU and part of the group that did the proposal with me. And I am saying, because he's here, it's good to acknowledge. In terms of the hospital management information system, we have a strong one where we have integrated all the systems from doctors to pharmacy to to lab system, all the systems, and therefore it is paperless. You don't have to prescribe on paper. You just put it in the system. The pharmacy people will see it online, and there's also an app for the patients. As you said rightly, they can book online. They can even see the next appointment. So it is working very well. However, as you asked, there were some challenges. The first challenge was the uptake. I think, as you said earlier, the change management. People didn't want to use the system. They were still used to prescribing on paper. And we keep telling them, you do it on the system. And there are many reasons for that. Some people don't want to be accountable. When you have a system, you are able to see which doctor saw which patient. We can say Dr. so-and-so today was able to see 10 patients, and whatever money was collected for the government, you are able to tell. So that accountability is there. So the first challenge was, uptake. People just change. People don't want change. Other than that, it has taken off very well, and we are very happy with the system.
Thank you for that. Just to keep the spotlight on you, could you share other technological innovations within the hospital that have accelerated healthcare delivery?
I think we have been even forced into it, given some of the machines that we are getting. I think Kenyans know about the latest machine, which is CyberKnife. It's very, very high in technology, because you don't even interrupt with the machine. You program the treatment, and it's all done with the machine. So you actually stay away and let the machine, once you program it, then it's able to treat the patient alone in that room. So very high technology. And also even with the other machines like the PET scan that we also brought in. I think we are also the second hospital in the country to have it. It's really helping, because once the doctor said patients, and then they go through the PET scan, we are able to send those images straight to the doctor. It's no longer the case where you go with big envelopes carrying the images. We are able to send to the doctor, and the doctor is able to see at a glance very early what the problem is and even start the treatment. So my point is that we have been forced into it because of the machines and technology that we are bringing in, and that has really helped.
Thank you. Thank you for amplifying how this is improving even the health outcomes. Let me move to Dr. Ayenda. And we've heard from the policymakers, we've heard at county leadership, and now we go to a facility where the rubber meets the road. Shibwe Sub-County Hospital has undergone remarkable transformation. We've heard you've gone 100% paperless. Could you just tell us how that journey was and what are the benefits, but also challenges you faced? And then if you were to rewind the clock, from a leadership perspective, what would you change to be more successful?
Thank you very much, Dr. I'm really excited to be here, to be seated with some great men of Kenya to share a user perspective on digital health. Digitization, we all agree, is the way to go, and we should all embrace it. Shibwe Sub-County Hospital is a level 4 hospital in Kakamega County from Ikoromani Sub-County. Our journey started 4 years ago, and during this journey, we have been able to use Kenya EMR Plus to digitize our processes. This has been possible through the assistance of Health IT, a project that is being implemented by Nairobi University in Kakamega County, together with Masinde Muliro University. For sure, I must thank the national government, the county government of Kakamega, for the leadership they have shown so far to implement that program. What are the benefits so far? To digitize health service provision, first and foremost, reduces waiting time. It reduces turnaround time. This one is made possible from a module that we have that is called clinical module, where a clinician, just at a press of a button, you are able to key in signs and symptoms of a patient. You have access to various laboratory investigations that you can order for that patient. You have access to make a diagnosis. And by the way, the ICD-10 approved diagnosis. And from there, care and management is very well provided by the system, meaning the system alone can tell you as a clinician from the comfort of your seat, there are drugs available so that you may know which drug to prescribe. And not only that, we have another module that has been able to give us unique patient identifier from the CCC module. That is from the PLHIV. This one has been able to curb re-enrollment. Like an example, if a PLHIV in Shibwe Sub-County Hospital for one reason or the other defaulted on management and then left for Nairobi, went to Kiambu or Amuranga Hospital, and then maybe seeks another enrollment, he will be told, no, you are a non-patient, and therefore we engage from that level. That is the beauty of that system. Not only that, outside the clinical area, we are able to improve on revenue generation for the facility and for the county in general, so that, and how are we able to do this? The finance module that was put was able to pick a patient's transaction ID from the patient's phone and provides a receipt. Since we started that, we have only seen an upward trend on revenue collection. So digitization for sure is a way to go. The benefits are many, but the journey has been tortuous. A few challenges that we saw in any change, there is that rigidity from staff, but with the training, with induction, and for sure, health IT staff have been very much in hand when called upon, even during odd hours, to help us. System challenges, at times missing out certain diagnoses, but we have worked around it so that everything is provided for. I'll give an example. The system provides for diarrhea as a diagnosis. But again, the ministry has given us guidelines on IMCI to break diarrhea further to show whether the patient had signs of dehydration or no dehydration. That one was missing, but we have worked it out and we are happy for that. And by the way, this channel from paperwork to paperless is a wonderful journey that we all must embrace. What could I have done better? As a leader, when change comes, let's embrace it. Let's embrace it and move on. And let's not forget that this system is web-based, and therefore when we have a few challenges here and there, network, of course we face a few challenges, and we have proposed already a few changes that have to make this a success. Thank you very much.
Thank you so much, Daktari. What I hear from you is end-to-end data visibility for decision making, but also I'm sure the challenges you've mentioned and what you'd do differently, other counties that are planning to pick this up will pick a few lessons from you. Mr. Onyango, now let's move to the specific application of some of these digital applications. We've been hearing ICHIS, and I know Living Goods, among other partners like Medic, have been at the forefront of rolling these out. What is ICHIS and how does it connect to UHC?
Thanks, Carol. I think it's a great question. I'll try to unpack it and simplify it a bit more. I think the acronym ICHIS fundamentally stands for Electronic Community Health Information Systems. What that is basically a platform that allows for service delivery at the community level in a more enhanced way, a more effective way, but also ensures that there's optimal coverage at the community, but not just working there, but also then linking it up to the facility. And what are then the benefits? Two ways. You know health starts from the household. Of course, then you can be treated, diagnosed, referred into the system, but also you can be referred reversed. Before I move forward, I just wanted to unpack part of those three words, because I think they're fundamental as a country and as a population as we move ahead. When we talk about things like efficiency or effectivity, what are we talking about? Now, I just want to set a bit of a scenario. We all know that we are a classical country where there is the double disease burden, meaning we have communicable still being managed, and we have very high incidences of non-communicable. So I think that puts strain and puts pressure on the health system like anything else, and resources are limited. So when you have a platform like this, what does it help you do? I'll just give one of those anecdotes. It's really, you can get early diagnosis for the non-communicable, you can get the communicable as well. I think when you look at overall, and maybe start tying it a bit to UHC, where we would want every Kenyan to get access to quality health care in a way that it also does not become resource decapitating, okay? Then now you bring in the next level, okay? When you have a more efficient health system, then what happens? Certainly, there's going to be a lot of what I call better planning, cost management, preventive promotive, which I think is a paradigm shift, what you're talking about right now. And the efficiencies and the benefits of that, I think, are things that you can't quantify. There's less people in hospital, less drugs being bought, and this can be invested somewhere else. Now, when, tying it just a bit more into things like broader, what I call vision of what we call HECs. And I think you highlighted it, what, of course, Living Goods, Medic, and other partners, many of us, actors in the ecosystem, have tried to do, is that critical is the digital platform. But I think I wanted to close my point by saying that let's not forget the other key pieces. I think digital is just going to be a leverage. So how do we invest across the other ecosystems to ensure that digital is effectively being utilized? So it's not about data collection, but it's about how do you utilize the data for decision making. And that decision making then makes a lot of things around it. So I'll give an example at the community health level, which is really where our expertise is there's going to be a need for a lot of capability building, training at the community health level, so that people can effectively utilize some of these resources. And of course, those efficiencies then move into the linkage data transmission up and down into how it's being utilized. I think to close on that, there's the element of change. We talk about change management. And I think that change management is going to be a long, long journey. I just want to talk about it. Yeah. It's going to be a long journey. I know this is a start. It's an exciting week, but I think as an ecosystem of players with probably 16 years experience on this, I think we have a long way to go. And also just recognizing that there'll also be changes as we move along. Because the platforms are not static, so they keep changing. Okay, so it's going to be what I call agile learning. How do we pivot and learn? And at times try new things. Some will fail, but also be open that we quickly adopt and move to the next level. Thank you.
Thank you, Mr. Onyango. As we wrap up, let me turn it over to PS to just crown the session. What are the maybe top 3 changes, the health sector will experience once the digital health bill is enacted into law?
Thank you. I think just to start with, you've listened to what each of the hospitals, those who are running hospitals, talk about, and the developer of the system, talking about the different systems on how it operates. I think the key one here, and that's what the ministry is doing through this digital bill that is being passed. And once it is passed, you will see that now there's going to be integration of all these hospitals and proper management of the hospital system, whereby patients will be able to access service. The other one, which is critical, is on the telemedicine. Now that we will have the digital system, which will be able to do referral in terms of where you are, the imaging. You can see also in the medical field, there's a lot of innovation and the use of technology. You've just been told on how they're using technology on treatment. And therefore, it is important that we have this bill passed. Once it has been passed and accepted into law, then it gives everybody, private sector, private hospitals and the public hospitals, they will now be equal in terms of service delivery. So previously, a lot of investment had gone in the private sector in terms of these systems. Support, like, for example, KUTRH, where there's a lot of support in terms of innovations. But now we want to standardize this service delivery across the country once the bill is passed. So it is really going to cause revolution, and it's going to help us. And that's why it's one of the 4 pillars of achieving universal health care coverage. So it is important that we pass this bill for standardization, for innovation, and to support treatment in our hospitals. So it is easy. You can see Dr. talking about being paperless. How the patients walk in there and they are treated without any challenge. Yes, the issue of change management. I think once we make it a law, then it will not be difficult for them to change because it is provided for in the law. And that's why it is important to have this passed and made it an act of parliament. Because then there will be consequence. So when the workers start seeing that there's going to be consequence, it's a must, then they have no option. They have to change. But previously, you have to persuade them. You have to tell them, do this. It's like, it's only your idea. Maybe they'll say, this is the Governor Kangata's idea. But once you make it to be a bill, an act of parliament, then it is like a hospital must. All right? So the other thing now, we talked about the system developers. They will have to develop systems that will be able to speak to each other. And that's why we are providing the ecosystem, where it is going to be interoperable in terms of the systems that are developed differently. You don't have to worry. You develop your system, but you'll be able to speak to the main system, which is the health ecosystem that is being managed and run by the government through the digital healthcare bill. So we are now going to come up with an agency that is role and responsibility is to make sure that all these systems are able to speak to each other and they're able to provide efficient services in terms of providing healthcare across the country. Thank you.
All right. Thank you so much, PS, for really clarifying what the digital health bill brings to us. I've heard standardization of care. I've heard you talk about opening up opportunities for partnership and collaboration across all sectors and many other benefits. As we end this panel discussion, I want to express my profound gratitude to the panelists. It was a very exciting session, but we have to cut it short in the interest of time. Thank you for being vulnerable, sharing the goods, the challenges, and the opportunities. We really appreciate that. Now, to the audience and everybody, we've heard from government, national government, through PS Kumtai. We've also heard from the county governments and really heard their commitment to advance equitable access to healthcare while leveraging on digital health. We've also heard from the implementing partners and facilities on their experience, but also they have candidly shared the lessons learned. And collectively from the panel, we have heard the value proposition of digital health. I think it's quite obvious from the panel, there is something for each and every stakeholder. And as I conclude, I'd like to urge us to make sure that our commitments, our discussions transcend this gathering. Healthcare is a shared responsibility between government, between society, and so many sectors, and it calls for us to plug in for a healthier and digitally connected future. Thank you so much for your participation and active engagement. God bless you. I'll request the panel, we take one group photo as we step out of stage.
Let's give the panel a hearty clap as I sit. Please, those on the booths, we need to suspend what's happening in the booth so that we get to the final bit of this. Assist me with the podium, please. The podium. Thank you very much. I wish to call to the stage Dr. Davis Kimanga of CDC. We will shorten the people I'm going to call. You'll have 5 minutes each. He'll be followed by Dr. Veronica Buto and Mr. Brian Letman, the PEPFAR coordinator. So the three, you'll have each 5 minutes to make your remarks. Please join us on stage. Let's give him a hearty clap as he comes over.
Thank you. Natengeneza slides.
PS Broadcasting and Communication, other PSs present, esteemed guests and dignitaries, ladies and gentlemen, good afternoon. Today, I'm honored to share the incredible journey of health digitization in Kenya, a story that reflects our past, our progress, the lessons we've learned, and the boundless opportunities that lie ahead. The overall mission is to contribute significantly to achieving universal health coverage through the power of digitization. So let's begin with a look at the evolution of health reporting in Kenya. In the not so distant past, health records were kept on paper and transported through postal services, what we also call a snail mail, or delivered by hand. We then transitioned to... What's happening? They're projecting there. Eh? Oh, sorry. Okay, sir. I think that's okay. Thank you. We then transitioned to Excel reports that were initially submitted through emails and later through a process that we called file transfer protocol. Of course, these processes were inefficient for planning and service delivery, and as a result of this, from the year 2010, electronic reporting systems were innovated and explored. In that same year, Kenya became the third country in Africa that adopted DHIS2 after South Africa and Sierra Leone. This transformation allowed health facilities to input data through their tablets, mobile phones, and computer, and that data was immediately accessible to all stakeholders, health care workers, and also the health policy makers. The platform has now empowered the health sector to monitor and manage services down to the community level, a crucial step towards achieving equitable, universal health access. The slide that we are now showing is really the history from the HIV program. And what has happened within the HIV program, it became increasingly difficult to manage paper records within that program. Imagine someone who was diagnosed with HIV in the year 2000. To date, they'll be having a very huge file that becomes difficult to track their entire history. So in reality, it became very difficult to manage paper records for HIV patients. The registers were filling up, old records were fading, and this was affecting the quality of care. To address this particular challenge, the HIV program worked very closely with the then Directorate of Public Health to implement digitization. That process had three phases, and it's important that I take you through these three phases. Phase one was actually just changing the record into a digital format. So really digitizing the records that already existed so that they are not getting lost. At this phase, the data clerks were the main persons for this particular program. They were the ones who were entering the data after the client has left the facility. In phase two, the focus shifted from data and reporting to now the patient, where the systems were designed in a way to follow the clients through their healthcare journey. And in addition to that, the process was made in a manner that it spoke to the provider, so that as the provider was using the system, it made their work easier. And this was important because at the end of it all, you are taking care of the provider and the patient. Another very important component that was added at that point is what we are calling clinical decision support. Clinical decision support is when you use the system to remind the provider of the services that are due to the client at that particular visit. So every time you come, the system flags and says you are due for this set of services. I think as the first actually improved service quality, reduced cost, and enhanced system buy-in among healthcare providers. So for change management to work, I think there should always be that notion of what's in it for the provider so that they buy into it and they work with it. The third phase now moves from the patient and looked at it at the population level. So in this phase, and this is the phase we are in, it's very, very exciting because we've started applying what we call big data analytics, artificial intelligence and machine learning, where you are using the system to predict a client who is likely to have an unfavorable outcome, and as a result of that, you are able to intervene and ensure that that unfavorable outcome does not happen. Bwana Chief Gate, I really want to say that right now as we speak, this particular solution is already deployed in more than 2,000 sites in the country, and this is probably the largest public sector implementation of any machine learning initiatives. I think the next one, which is very, very exciting, and I can see the slides are moving faster than myself, is this particular component. Really what was launched yesterday, where we are beginning from the community app. And I think this is very, very powerful because at the end of it all, the use of ICHIS will enable us to track preventive and promotive services at the community level. And this is indeed a radical shift in focus from curative to preventive health services. Indeed, this is a game changer for Kenya, and we want to believe it will set a global standard towards achieving universal health coverage. The other thing that was launched yesterday is the Smart PCN, and I can see, maybe we can click next. So this is now the system that are deployed at the health facility level. And the most powerful thing here is demonstrating the connection from the community to the health facility. And at the health facility, regardless of what system you are using, at the end of it all, information is being exchanged across. And this is very, very important towards having a working PCN that ensures that the patient can be managed from whatever system that we are using. Next slide. So following the directive from the MOH leadership, the Directorate of Digital Health is already spearheading the development of a digital superhighway comprised of shared digital tools. And this is powerful because for us to ensure systems can communicate, it's important that these shared utilities are available. So what are some of these shared utilities? We heard of the client registry, which allows us to identify who the client is across all systems, not just one system. If you move from this system to the other system, they know that they are dealing with this same individual. And this is indeed very, very powerful. We have taken more than 12 years to get here, to be honest. And I think that's a story for another day. But today, as I stand here, I'm very excited to say that the client registry is up and running, and there are a number of systems within MOH that are already using this. The next one is the health worker registry, the provider registry, so that at the end of it all, we know which provider is providing these services and whether they are certified or not. This is important to provide quality services to the client. The next two are the health facility and the community unit registry. It will help us to understand where these services are being provided. The next one is the health terminology registry, and the terminology registry standardizes language across systems so that if it's malaria in this system, we know it's the same malaria in another system, and that is powerful in terms of communication. And the very last one is what we are calling the national shared health record that gives a minimum data set that will allow continuity of services across most facilities. This highway allows seamless information exchange among healthcare systems in Kenya, providing the common mwananchi with comprehensive services at any facility that has a digital system. Indeed, Kenya stands out with the ability to really foster safe and ethical sharing of health data, which is going to be a pioneering effort demonstrating our commitment to healthcare innovation. The next one. Yeah, I know every time we talk of HIS, people are focusing on the S. A definition of HIS is just a system. But I really wanted to tell us that in HIS, there's an H and an I. The systems need to be at a level where they are able to generate information about the health of individuals and by extension, the population. And this is indeed powerful. So let's not just focus on systems for system's sake. The systems must help us to really manage better health and achieve good outcomes for all the clients that we manage. Next. So as I conclude, I would really want to appreciate the key stakeholders who have played a key role to get us where we are, especially in the health digitization agenda. First and foremost is the Ministry of Health and ICT for their visionary stewardship, exceptional coordination, and provision of a policy environment that has made this possible. The county governments, of course, for spearheading the implementation of digital solutions in their facilities. The US agencies, I think they played a key role, the CDC, DOD, USAID, and PEPFAR, for really helping us in the health digitization agenda, not to forget the dedicated teams from Living Goods, Luala, Amref, and Medic Mobile for their support in digitizing community health services. Last and not least, our healthcare providers and patients who have embraced these digital solutions, making healthcare in Kenya smarter and more accessible to everyone. We've come from far, we've achieved a lot, but I think the future is much, much brighter, especially with what we've been doing in the recent past. Asanteni sana, and I know time is up.
Thank you very much. Let's have Dr. Veronica Abuto. After 5 minutes, I will be on stage. Welcome, let's welcome her with a hearty clap. Thank you.
3 minutes.
Okay, thank you. The slides are up.
Our chief guest, PS Broadcasting and Telecommunication, extinguished guest, and all protocol observed. Good afternoon. I'm Dr. Veronica Abuto from Kitengela Sub-County Hospital. I'm here to share with you a case study of digitization in a health facility to show you that it is doable, and has as a health facility, patients and healthcare, we can embrace the change and move on. First of all, I'll go to introduction. Kitengela Sub-County Hospital is a level 4 hospital in Kajiado County, bordering Machakos and Nairobi County. We have a very high patients workload with a coverage of 60,000 population. On a daily basis, we see up to around 700 outpatient and inpatient, and the hospital also has both inpatient and inpatient. So first, I'll take you through the journey of implementation. Implementation of Afya KE in our facility was done in phases, and we did this so that we can be able to address the change management issue. First of all, we went to the county leadership. We had a meeting with the county leadership where we did a presentation and sensitization. After that, we started with change management at the facility level. This one took some time for about 2 weeks, where we engaged the health management team at the facility level. We had a series of meetings telling them the importance of digitization and how it's going to benefit the patient and give them a great experience in offering their services. After we are done with us, we did deployment and configuration of the system. We were lucky as a facility that before the implementation, our infrastructure was a halfway. The health IT, with the help of health IT, we had the cabling which had already been done. So as a facility, we were supposed to buy end user equipment, which we did. And we want to thank our county government because they allowed it and approved a budget. Though it was expensive at the initial cost, but the benefits is going to outweigh the cost of implementation. So as you see the framework, on 29th of November, we went live after the dry run on 25th. So the Afya KE system in our facility is end-to-end. It covers the inpatient and outpatient complete. It's paperless. Even in the maternity, it's paperless. Even the cardiacs, everything we do is paperless. So, as you see, the key characteristics is end-to-end, patient-centric, Operational at the facility, multi-tenant, which means this system can be installed in our facility and other facility. And it is role-based, meaning that each and every healthcare person can only view what they are supposed to view. If you are at registry, you only view registration. If you are a clinician, you can only view clinical notes of the patient. So we go to what made us succeed as a facility, because as we've heard from most of our presenters, change management is an issue. First, it was the support from MOH and Kajiado County government. When we were doing sensitization, the healthcare workers were told digitization is the way to go and there is no option, and in case you don't want to change, you will be transferred to another facility. I'm sorry it was like that, but it had to be like that for it to be achieved. Then also another thing, the system was user-friendly. So it motivated the health staff to adapt to the system. So I'll go to the benefit of the Afya KE to patient. That is one of our patients. They are being seen by one of our clinicians at the photo. So the Afya KE system has markedly improved the patient experience at our facility. This is due to various factors. There is improved quality of care. There is convenience, like one of the presenters said, you don't need to carry papers around. It is paperless. You only have to carry your ID every time you come so that you can be activated in the system. This has also resulted in reduced turnaround time, and also the cost of care has also reduced on the patient side. Wanjiku don't need to always carry the results of the X-ray and the lab. And there's no way you'll be told that, Mama, your results are lost, go and do another test. So this one has also improved. Then it has also improved the trust we have with our patients, because there is privacy. There is privacy of the data. You can only access to the data when you are an authorized person. What are the benefits of this system to our healthcare? I'm also a healthcare worker. I'm a doctor in the facility. What are the benefits of this system to me? The system has made us to improve the care we offer to our patients. This is because we save a lot of time. We don't need to do writings, and we only have to click on the patient and identify, and you are going to see all the tests you've done to the patient, all the visits the patients are done in the facility at various points. It has also helped us to reduce duplication of services. And another thing which this system has also helped us a lot is decision making. The system is web-based, which means that even if I don't have a computer at the facility, so long as I have a smartphone and I've installed the system, I can always consult with my colleagues. And I don't need to give all the history of the patient. I'll only give the name of the patient or the unique identifier, and my colleague will be able to help me make a decision and support the patient. So that was the graph you see is at the workload, which has also increased in our facility due to the installation of system. This one can be attributed to good capturing of data, compliance in reporting, and it can also be attributed to many patients coming to the facility due to efficiency. So we also narrowed down on the benefit of the system to the facility as a whole and the county government. The governor has told us that there are many projects which are being run by the county government, and finance is the key. So this system also has made us improved in our collection. The first time we installed the system as our facility, we were collecting 1.5 million. When we installed the system, the next month we collected 3.4 million. And our graph has been going up in collection. So the digitization of healthcare, however, it is costly at the initial implementation, but you will find that at long run, it will be an advantage to our government and even to service delivery. Another advantage also is commodity commodity management. As a government facility, I know we always have issue with commodity management where there is a lot of wastage. The system has an inventory, so all our commodities, when we receive them and dispense, is through the system. This has made us to really reduce the cost we use in commodities every day, and we can even ascertain the amount of drugs we used, where they have gone. So we also had challenges when we are doing the system implementation. And one of them was infrastructure. As we are told, you need internet connectivity, you need end user equipment, and you need stable power. So in the infrastructure, what we did, with the support of the county government, we were able to get end user equipment, internet connectivity, we were able to contract a private provider, and now we have two, so that when one goes down, the other one can be used. Also, we had a challenge of basic digital literacy. When we implemented the system, for our part, we used to have workers who even refused to look at that computer. They told me, Daktari, I'm not accepting it. Some even have to force their fingers to type, because they are saying they have never used a computer and that is the first time they are using. So it was a great journey, but being persistent to change and having the vision, we were able to manage. So my take is that as we do the digital health bill, and also for our health workers, we must insist on digital literacy, basic digital literacy, to enable us realize the implementation of digital health. My take-home note is that it is doable, and as healthcare workers, we will embrace it because it improves our work and gives us a lot of time to be able to serve our patients better. Thank you so much.
I'm so sorry. Thank you very much. Give her a round of applause. I'm so sorry. I'm also working on the concentration of your audience because of the time. I will ask Mr. Brian Retman, the PEPFAR coordinator, to come and speak about the role of development partners in health digitization. 5 minutes, sir.
I will be brief. Thank you all. Let me just say all protocols observed with all respect to PSs, governors, and all of the esteemed guests here. I'm very honored to speak at this digitization session on behalf of the development partners. Speaking from years of experience of working with PEPFAR, one thing you really need is reliable data. And that's really at all levels. The individual level, the community level, county level, and national level, and global level. It's glad to hear acknowledgments this morning of the work that PEPFAR has done over the last 20 years in Kenya. And I'm glad to be that we're recognized as pioneers in this digital health space. The role of development partners in health digitization is to continue to work with the government of Kenya to achieve its mission towards the development of comprehensive integrated digital health information system. The development partners will lead with the government of Kenya to collaborate towards building a comprehensive digital system that captures all health data from service delivery level, from all service delivery levels. This system should enlist all individuals in households, in health facilities, and health facilities from entry to exit. And also it should perform disease surveillance. That system should also provide patient-level data and at all service delivery points and facilities. It enables patient and specimen transfer, and clients can interact with the systems themselves to be able to see the data for themselves on their own health. The digital system that would provide a comprehensive statistics and reports to aggregate all service delivery sites, aggregate all levels of health care, and provide reports, analytics, and visualizations for all levels, and also provide commodity security. The development partners are also really would like to continue to work and collaborate with the Ministry of Health to build integrated systems that are integrated both at the state and non-state databases to inform decision-making across community and facility levels. That would include ECHIS, KEMSA, NHIF, or the new iteration of NHIF, banks and M-Pesa, EHRs, and also special services. The interoperability is really key to making this work. So development partners will continue to work and collaborate with the Ministry of Health to build interoperability between health systems that are patient-centric and compliant with the Data Protection Act, and also data health governance. Building that interoperability between community and facility-based digital solutions is really critical. And interoperability between EMRs to both include the community and facility data to make informed decisions will be key to moving forward. The last piece I'd like to talk is on data health governance. The development partners will continue to work and collaborate with the Ministry of Health towards data health governance framework. Welcome, CS. So we will continue to collaborate and finalize the data health governance framework for Kenya and continue to collaborate and strengthen the Kenya Health Master Facility List and the Kenya Health Enterprise Architecture. Thank you, and I look forward to continued exciting sessions. Welcome, CS.
Thank you very much. A round of applause, please. Welcome, CS Health. We are now going to the final bit of this session. I'll be inviting the PS Medical Services. I'll be inviting the PS to handle the remaining bit so that you can have the CS and the chief guests be able to address us. So PS, please come and handle the final bit of this program. A round of applause for me for playing my role. Thank you very much. Thank you.
Another round of applause for Dennis. He has done very well. He has kept us really engaged. Our chief guest of today's session, our colleague, Professor Edward Kisiang'ani, who is a PS for Information and Telecommunication, Broadcasting and Telecommunication. Our Cabinet Secretary who has joined us, Nakumicha Susan, our governors present here today, Wesley Rotich, Kangata, the Deputy Governor Kericho, my colleague PS Mary Mudhoni, senior members, chairs of the sagas. I want to say good afternoon. I know we are now used to the climate of Kericho because in the morning it was the sunshine was there, very nice, everybody wanted to come out. After a certain time, and it goes with that time, that by this time, between 1 and 2, it must rain, and that's Kericho for you. So all of us are now getting used to the climate of Kericho, and again, I want to say thank you so much, the people of Kericho, for welcoming us. We've had our enjoyment. I think the exhibition has been going on very well, and the attendance is very well, Madam CS. I therefore want to run you through this program within a short time so that people can have time to go and participate in the exhibitions. Allow me to give this opportunity to the Deputy Governor for Kericho County to come again and just give us assurance and welcome us and tell us more. Maybe we don't know in the evening what will happen. So we need to know more. Welcome, Deputy Governor.
Thank you very much, PS. The chief guest for today, PS Information and Broadcasting, Cabinet Secretary for Health, all protocols observed. I want to take this opportunity to welcome you for today's session. As a county of Kericho, we are really privileged to host this event, to host the Mashujaa Day that is on 20th. And this has actually given us an opportunity to have you here. And we are very, very grateful because as a county, we are privileged to host this year's Mashujaa Day, whose theme is universal health coverage, and we'll be looking forward to having this bill signed on Friday by His Excellency the President. So we are really, really grateful, and we're asking you that you explore this county. I know it is cold, but you bear with it. That is why we have the tea that you drink every day, and we're asking you to take a lot of tea so that you can get out the cold. So thank you and feel welcome. Thank you very much, Bana PS.
Thank you, Deputy Governor. I think we've gotten the secret that why it rains is because you must take tea in the evening. So today, everybody is invited for a cup of tea. Sample the tea of Kericho. We've seen it. It's so beautiful, but it says it must rain for you to take tea. Thank you so much, Governor, and thank you for your hospitality here. Allow me then to welcome the Governor for Elgeyo Marakwet, Wesley Rotich, to give his remarks.
Thank you so much, PS, our chief guest, Professor Kisiang'ani, our CS Health, our PSS who are here, head of government departments, our partners, our healthcare workers who are here. Good afternoon. I'm here in my capacity as the chair of the Council of Governors ICT Committee to deliver a brief speech on this journey of digitizing health. I was a deputy governor in the previous dispensation, and this was my passion. And when I became the governor this last year, by the virtue of being the youngest governor, I think I was given that chance to head the digitization or the ICT. And my first job that I had promised my colleagues was I'm going to ensure that we have two things. The first one is to have a uniform revenue collection system and to have an health system for all Kenyans, which is unified across the country. We were doing it differently from COG because we wanted it to happen because every county was buying a disjointed system everywhere and doing different things everywhere. And when we met with CS Health and she was telling us what she was doing, I thought she was joking. By the time we were going through the digital health bill draft, I realized it was a serious business. I'm very happy to be part of this transformation journey, and it has happened in my lifetime, first as a governor, and secondly when I'm still alive, because this has been the biggest problem for all Kenyans. When you go, it's very frustrating to go to an hospital, to be taken through CT scan or X-ray machine twice in less than a week, because the doctor does not have any information about your ailment. Because you've traveled from Western Kenya to Nairobi, you have to go through the same system again. But with this now, everybody will be having their information, and it will be very easy to even look at your history. The treatment and the experience will be different. As governors, I want to promise this conference that we are going to support this. I want to appreciate the Ministry of Health team who have been on this, and tell you, you have our total support. The marriage of technology and healthcare in the form of digital health innovation has paved way for a remarkable progress in patient care, healthcare accessibility, and even cost efficiency. From telemedicine and wearable health devices to health data analytics and AI-driven diagnostics, these solutions have significantly augmented the quality of healthcare delivery and patient outcomes. At some point, I had actually looked for a provider in a country called Turkey, and I was asking him some questions. I was asking him, how can I know the prevalence of a certain disease in my county? How can I know that a certain section of my county suffer from a certain disease, so that I can have targeted interventions, not general interventions for everything and waste resources? And when this came out, I was actually interested in machine learning and AI, so that it can be possible for research and for even evidence-based decision making in healthcare. Because as you speak, no one tells you we are doing trial and error in almost everything, especially in our policy making and interventions in the health sector in Kenya. I am the most happy person here today, and I don't want to say much. We only have few challenges. Challenge number one is connectivity. I have told my colleagues, including my able deputy or vice chair Kangata in the committee, that we want to make sure every county gives free way leaves to any organization which want to lay fiber optic. It does not help for me as a governor to charge small revenue, probably 1 million shillings or 500,000 shillings, to a company laying fiber optic cable and deny my people health services or deny my youth job opportunities. We have said we want to waive that so that internet can penetrate. The second issue is capacity building of our health workers. We have a challenge there. All partners in this room, please help us at the Council of Governors to ensure that we train all our health workers to understand what it is to be here. Even this law that is coming, we need to make them understand so that they can own and ensure that we have this thing work very well. Another challenge we have very few IT experts, and it's the reason, no one has ever told us, it is the reason why we've been very slow in this digitization journey. Few people believe in it because we have few experts. We still need to train, especially those ones who will understand this healthcare system. So I want to say those are some of the challenges that we may be facing, but of course I have experience as a governor when I started this in my referral hospital. The first people to actually frustrate the process is actually our health workers. I don't know why, because I realize it is a very easy system to use, because even a doctor, you can just click in the unique patient number and it brings up the patient records instead of you going to look for a file. We need to tell our health workers to accept this so that we can be able to move very fast. Otherwise, from my desk as the chair of ICT, I will support this program to the end to ensure that Kenya moves to the next level and we become a trailblazer. At the Council of Governors, we have something called knowledge management, where we deposit all success stories. I can't wait, as the chair of that committee, to go and deposit the digital health experience of Kenya so that the entire world and the entire region can learn from Kenya. Thank you very much, and God bless you.
Another round of applause for Governor Wesley. The assurance the governor has given us is that this digitization will be implemented in the counties, and they are ready to implement in the counties. So, Madam CS, you can see now that once you roll out, once this digital bill is enacted into an act of parliament, then your job will be done. In terms of delivery, you will have delivered UHC for this nation. Allow me then to take this opportunity to welcome our Cabinet Secretary to give a few remarks before inviting our chief guest. Welcome, Madam CS. Thank you. Oh, you go now at the center.
Thank you. Thank you. Our chief guest for today, Professor Kisiang'ani, PES for Information, Excellency Governor of Elgeyo Marakwet, Governor Wesley, Excellency Governor of Murang'a County, Governor Irungu, Deputy Governor, our development partners present, our sagas present, senior ministry officials present, good afternoon. I am very happy this afternoon to be hosting you all for day 2 of our celebrations. And I would never be happier than when we are talking about digitization. Because as somebody who is in charge of the ministry, I know that through digitization, we are at least going to be able to have real-time data that we can use for decision making. Many often, we have not met expectations on many fronts of healthcare. And it is because we have been relying on either no data or inaccurate data or outdated data. But with this digitization, I believe we are going to make the right decisions, informed choices, because we shall have real-time data. We have an ambitious target to ensure that we have an interoperable system to create a health digital superhighway where everyone that is providing healthcare can connect to, where health workers can connect to, those providing commodities can connect to, those providing health financing can connect to. It is an ambitious target, but I know that together with my team at the ministry, being led with Dr. Langat, with support from partners, I am sure that we are going to achieve this ambitious target. And we have a plan for what we intend to achieve in the short term, in the medium term, and in the long term. So mine is to ask all the partners present to support us on this journey. It is going to make your work easy. It is going to make my work easy. And I want to thank you, Governor Wesley, for confirming that as COG, you are on board, because this will equally make us be able to communicate. And as you are very well aware, we have finalized on the digital health bill. Actually, we're expecting that the president should be ascending to it on Thursday into law. In there, we have ensured that we are taking care of the privacy of data, that there's limited access or guided access. You are only given right to that which you need to know or ought to know. Governor, we have equally ensured that each of you governors will have access to the data that belongs to your county. So once that bill is in process, and I believe enactment will be on Thursday, we should be able to move along very well, having protected the privacy of people's data. And I believe that is going to be a game changer. It is going to be our springboard in terms of what we want to do to ensure that we have full traceability, full visibility in what we do in healthcare. So thank you very much for the support. And thank you, Professor, for coming to represent Waziri Owalo. I know he's out of the country, but I'm confident that you are able to represent him well. Asanteni sana, and God bless you. I forgot. I'm supposed to invite our chief guest. So will he be upstanding? Kindly. A round of applause for our chief guest, Professor Kisiang'ani. Let's clap for him until he gets up here. Keep clapping, keep clapping, keep clapping, keep clapping, keep clapping, keep clapping. Thank you. And he's my brother.
Before I do the salutation, I would like to make one thing clear: why the CS was not able to do what he was supposed to do initially is because we as PSS are supposed to be inviting her to speak rather than her inviting the PSS. But the explanation for that is that I'm here to represent the CS, my CS, who is the chief guest. So it has caused some bridge, and I ask you to bear with us. So I think it's important to note that so that you don't probably speculate that something is wrong. So our distinguished CS Health, Susan Nakumicha, the governors present, led by the deputy governor hosting the event from Kericho, governors Wesley Rotich, Elgeyo Marakwet, Governor Irungu, Kangata, Muranga, and the representatives of other governors, my colleague PSS, Harry Kimtai, of course, Medical Services, Mary Muthoni, Public Health and Professional Standards, and all protocols observed. May I thank you for coming and go straight to deliver the message from my principal secretary, my cabinet secretary, who is away in Rwanda for official duties. So I'll not tire you with the salutations, but I will go straight to what I'm supposed to do. I think we are all in this, and I want to thank you for coming here, but to also invite you to note that the Kenya Kwanza government has adopted the thematic approach to accelerating these national holidays that we have here, so as to pick on certain themes that are important for the Kenya Kwanza government in general. The dialogue on digital healthcare is crucial, as you know, ladies and gentlemen, because it is crucial to our conversations about the welfare of our people, especially in the context of the unfolding world order that hinges on the fourth industrial revolution, which is defined by the digital explosion. The significance, ladies and gentlemen, of the health sector in our national life cannot possibly be overstated. The founders of our nation knew 60 years ago that healthcare was one of the three pillars of a government that is concerned with the welfare of its people. Apart from healthcare, we have the two other pillars, the pillar of education, which is represented by the war against ignorance, and the pillar for wealth creation, which is represented by the war against poverty eradication. Ladies and gentlemen, in the 21st century, the interplay between healthcare and the digital economy is becoming increasingly important. The world is moving away from the legacy platforms and the methods of doing things and embracing the modern digital platforms and methods. We are moving away from doing things the traditional way to more complex, ultra-modern platforms. The goals that we seek to achieve remain the same, but newer, faster, more efficient methods are necessary. That is where digital technology comes in. Nations that have fully embraced technology are surging ahead of everyone else in all spheres of life, healthcare included. President William Ruto's bottom-up economic transformation agenda, which we call BETTER, has identified healthcare as one of the 5 critical pillars to be embraced for accelerated national development. The government has recognized the role of digital technology as the facilitator of its entire development agenda. Accordingly, ladies and gentlemen, we in the Ministry of Information, Communication and Digital Economy are in a very special place today as we generate and initiate efforts towards realizing the Kenya Kwanza Universal Healthcare Agenda, which of course is the focus of this conference. We have a vital role as a delivery agent in providing the digital economy with the necessary instruments to drive the digital healthcare. The starting point for us is the provision of the physical technological infrastructure. The ministry is currently rolling out 100,000 kilometers of fiber backbone infrastructure, targeting health facilities, schools, marketplaces, the judiciary, and other public institutions. Alongside this is the ongoing establishment of 25,000 public Wi-Fi hotspots. These ones will be located in marketplaces, bus parks, and other public spaces. The government also intends, ladies and gentlemen, to provide 1,450 village digital hubs geared towards spurring e-commerce, the creative industry, and the digital economy. As you can see, 1,450 digital hubs mean that at least every ward in our country will have a digital hub. And it is in these digital hubs that digital skills will be taught and enhanced. Ladies and gentlemen, the government agenda is expected to fast-track past health initiatives in which all level 6, level 5, and some level 4 public hospitals have been connected to the digital superhighway. Ultimately, all hospitals, including level 3 and level 2 hospitals, will be connected to the digital superhighway. One of the main challenges that we see in the health sector in Kenya today is the lack of real-time patients' records and data, which the CS has alluded to. We don't have real-time data. We don't have effective diagnosis and decision-making procedures. This has been aggravated by the slow adoption of digital health platforms. And this has continued to fragment, to silo our health systems, as well as to undermine our road to digitization. This stands out as one of the most critical areas that technology must address, and it is doing it. We see total digitization of healthy services as key in the achievement of universal health coverage. And by this move alone, ladies and gentlemen, we shall streamline the health information exchange systems and enhance care coordination for our patients. An interconnected digital health ecosystem is important because it will secure timely and accurate diagnosis and treatment, and accordingly contribute to equitable access to quality health care for all our citizens. To achieve digital transformation in healthcare, the National Health Information Exchange Network has been envisioned as a crucial component of digital health superhighway. It will secure an efficient exchange of health data amongst healthcare providers across the country, and as well drive seamless communication in the sector. Ladies and gentlemen, the development of ICT, a robust ICT infrastructure is key to sustainable growth of the health sector. The use of ICT will accelerate the integration of e-health systems, some of which have been discussed here, including those that touch on telemedicine, e-learning, medical informatics, health informatics, telehealth, and information sharing in the health sector. And as you walked around the booth, you see really efforts to achieve that. Other aspects of strengthening healthcare institutions, including health management, information systems, and the use of digital financial services, including insurance and payment services, can be optimized and accessed through mobile phones, electronic cards, and vouchers. There is therefore need, ladies and gentlemen, to incorporate digital technologies, innovative solutions, and best practice in the health sector in collaboration with the Ministry of Information, Communication, and Digital Economy, where I belong. These technologies include data, big data, which is now going on, AI, which is artificial intelligence, data analytics, medical robotics, cloud computing, and the Internet of Things, among others. Adoption of these technological innovations can enhance performance and provide a solid foundation for future advancements in the health sector. Adoption of digital technologies in healthcare also needs to factor in the securing of digital healthcare systems and infrastructure against cyber threats. Ensuring privacy of medical and patient data is also key to the provision of quality health to all through digital technologies. And that has been repeated here many times. All stakeholders in the health sector, including Ministry of Health, county governments, the Ministry of ICT, development partners, private sector partners, non-governmental organizations, some of them are present here, and all other relevant stakeholders need to work together, collaborate in providing digital infrastructure that will enable the digitalization of health services and the digitization of current health records. There's also need to remain awake to identifying and rolling out digital health solutions on an ongoing basis, and taking advantage of existing national optic fiber backbone infrastructure to make sure that we enhance and improve on our procedures for providing universal health. This will encompass identifying the implementation and the connectivity solutions that will first track achievement of the healthcare sector and also benefit efficiently from the digital superhighway pillars that are part of the bottom-up economic agenda. In doing this, and with the support of everybody, in a few years to come, our country will have moved from where it is now to levels that could never be imagined a year ago. And with those few remarks, I thank you, and I thank you again for allowing me to read the speech by C.S. Eliud Owalo, who was supposed to be the chief guest. Thank you very much. Now, having said that, I just want to make two more observations before I exit. A few more observations. When you see things like the ones that we are talking about, you see this gathering that we are here we are seeing here, you see the transformation that is taking place in our country. You see in every public event, governors working together with principal secretaries, with cabinet secretaries. Let me tell you, distinguished citizens of our republic, it points to something special: leadership. The leadership that we have in this country, provided by His Excellency the President, is the reason why you are seeing these things. So don't take these things for granted, because they are a product of excellent leadership. If you go to other countries, some of them are neighboring countries to us, you don't see these kind of things. So through this leadership, let us appreciate our countries moving forward. Those who are still doubting, please hold their hands and move with them, because this country is changing very fast. So the people of Kericho who have hosted us, please pick everybody else who still thinks we shall go back to the manual processes, that it won't happen. So walk with them, walk with everybody. When we walk together like this, like you have seen, the entire government walks with everyone. All of us are here representing the entire government. That is how we want our people to work together in this. It is not a project for CS Health. It is not a project for PS. It's a project for all of us. So I want to acknowledge the excellent leadership that we have received from our president, and we think that this leadership is going to drastically change Kenya for the benefit of our citizens. The second thing that I want to say, and which is related to the first one, is also to just acknowledge something very, very special. And let me ask Professor Mugenda to come. Please come. You know, in the academy, thank you, in the academy, we respect seniority. I have been lucky to be associated with Professor Mugenda in the university. I've taught in the university for about 33 years. And when I started working at the university as a tutorial fellow, she was already a big professor. She rose to become the vice chancellor of our university, and she mentored most of us. So the leadership skills she gave us have helped us to go places. So I want to acknowledge you, Professor Mugenda, for mentoring most of us, and also to thank you very much, because most of your students, Isaac Mauran, Dindi Nyoro, the ones you taught, Gagusha, Joseph, Gladys Wanga, those students are doing very well in public because of the leadership skills you gave them. For us who served under you, I was your director for alumni programs for 7 years. You gave me an opportunity to learn the skills of management and also skills of relating to people. And I'm happy that you have not exited the scene. Continue mentoring other people the way you have mentored us, because I think I can make a contribution to our great country because of what you did to us. Thank you very much. Thank you. So in conclusion, I just want to say this. I've been honored to come here. Our presence in Kericho is the end of nothing, but the beginning of everything. Let us be part of this great dream of Kenya. Let us achieve universal health care, because poor health facilities have killed our continent. We spend so much time to educate our kids, and they have to spend all their earnings on health care, and that's why our continent has challenges of development. So with the initiatives like the one we are doing, I'm confident, ladies and gentlemen, that we shall be an example to the continent, an example on how we can change our continent to become health secure. Thank you very much, and God bless all of you. God bless Kericho. God bless Kenya. Thank you.
Thank you very much, Chief Guest. I will therefore now ask that we take a few photos. So Chief Guest, kindly join us on stage for the first photo. The CS kindly, PSS, governors and the Deputy Governor, please join us on stage. Please, yeah. Just move this way because of that. Please, let's move this way. Please, let's move. Professor Mugenda, please. Please, let's move this side because of that staircase. Let's move kindly. Take another step, Governor. Governor, please, another step this way. Towards me, please. More towards me. Okay. Thank you very much. Just stay there. You'll be joined by the digitization team at the ministry. Digitization team at the ministry, please join this photograph. And let's balance the photo on that side kindly. Medic Mobile, Living Good, Luara, Amref, CDC, Health IT, Kabianga, Path, please join the photograph. Just move one step, 2 steps forward, please. Yeah, there PS Modoni is. The ones who are taller, please. Oh, yeah, we can stand here. Yes. Okay. Yeah, please panga hiyo picha wewe kwanza ndio unafaa kuona panga. Yes. Dr. Martin, the line behind the CS, please come forward. Just come forward. We just leave that one line. Let no one be behind the line by the CS. Everyone come. Is that photo okay? Cameras, are you okay? Okay. Thank you very much. Just one final photo. You can sit down. Just the CS, the PSs, and the governors here on this platform. Here on this staircase. Let me have the PSs down here. Yeah. Like that. That's good enough. CS on top here. Just there. No, you're okay there. Yeah, like that. Then just one line. Kangata at the center there. Yeah, that way. At the center, yes. Hiyo iko sawa hiyo picha, tuangalie mbele. Onekani, CS onekani. Okay, PS, go behind so that you can see the CS. No, iko sawa. Thank you very much. Thank you. Give yourselves a round of applause. Thank you very much. We will ask the guests to leave. And we will then hand over this to the exhibitors to continue with the day. Thank you.
Shughuli nzima ambayo inafanyika katika uwanja wa Kapkatet hapa katika kaunti ya Kericho, na kumekwepo na shughuli tumbi nzima siku ya leo, wakati ambapo tumekuwa tukiangazia mengi kuhusiana na mpango wa afya kwa wote, kikubwa tukiangazia afya ya jamii ambayo ni afya ama ile shughuli ya afya msingi, ukipenda primary health care. Siku ya leo kumekuwa na shughuli ya kuangazia teknolojia au ukipenda afya kwa njia ya kidijitali, na ndiposa tukaanza kutembea katika vituo mbalimbali katika uwanja huu wa Kapkatet katika kaunti ya Kericho ili kuweza kuona mashirika washikadau mbalimbali katika sekta ya afya wakionesha ni kipi wanafanya katika kutumia teknolojia ya kidijitali katika masuala ya afya ili kuweza kushirikisha wale ambao ni wagonjwa au jamii kwa jumla ili kuweza kuhakikisha afya inaweza kutekelezwa kwa urahisi na kwa njia ambayo ni bora zaidi, na si bora tu afya lakini afya bora. Mtazamaji, shughuli hiyo ambayo ni siku ya pili ya shughuli hii nzima ya mpango wa afya kwa wote, tumeweza kumuona ama kuweza kuona viongozi mbalimbali. Tumeweza kumuona gavana wa kaunti ya Murang'a Irungu Kang'ata, tukamuona gavana wa Elgeyo Marakwet ambaye ni Wesley ambaye aliweza kufika hapa na kuweza kuzungumzia masuala ya lile baraza la magavana, mikakati ambayo wameweka wakisema kwamba wako tayari katika kukumbatia teknolojia ya kidijitali ili kuweza kuhakikisha huduma za afya zinatekelezwa kwa njia iliyo bora zaidi. Mtazamaji, swala lingine ambalo tumeweza kulishuhudia hapa ni kutoka kwa Wizara ya Habari na Mawasiliano, wizara ambayo inaongozwa na Waziri Eliud Owalo, lakini siku ya leo hakuweza kufika hapa. Aliyefika hapa ni katibu katika wizara hiyo, Profesa Kisiang'ani, ambaye amesema kwamba wizara ya masuala ya mawasiliano na teknolojia iko ange kabisa kuweza kuhakikisha mikakati mwafaka inawekwa ili kuweza kuhakikisha huduma za afya ziko katika mfumo wa kidijitali. Na vile vile, mtazamaji, usisahau kwamba waziri wa masuala ya afya Susan Nakhumicha ameweza kusema kwamba kuna ule mswada wa afya kidijitali ama afya dijitali ambao hivi sasa amesema kwamba Rais William Ruto anatarajiwa kuweza kutia saini kuwa sheria siku ya Alhamisi. Tutakuwa tunatupia jicho hilo ili tuweze kujua ni kipi ambacho kinajiri. Mtazamaji, shughuli hii ya kuweza kuendeleza hamasisho ya mpango wa afya kwa wote ilianza hapo jana. Leo ni siku ya pili, kesho vile vile ni siku ya tatu, kwa tunafuatilizia kuweza kujua ni kipi kinajiri na runinga hii ambayo imekuwa kwa kasi ya TV 47 na vile vile Radio 47 ambayo ni kituo ambacho ni dada ya TV 47 ndani ya mwavuli wa Cape Media. Tunazidi kufanikisha hilo, kuhakikisha tunakutaarifu yote ambayo yanajiri kutoka sehemu mbalimbali, na tukua tunapiga kambi hapa tukisubiri kilele shughuli nzima ambayo inatarajiwa kufanyika siku ya Ijumaa, siku ya mashujaa, haya yakiwa ni makala ya 60 ya sherehe hizo za mashujaa ambazo zitafanyika katika uwanja wa Green Stadium katika mji wa Kericho, ambapo Rais William Ruto atakuwa anaangazia masuala ya afya kwa sababu hiyo ndo kauli mbiu ya mwaka huu. Mtazamaji, ndo hayo kwa sasa tunatamatisha, lakini tuko ange kabisa kuhakikisha mtazamaji tunakujuza yote ambayo yanajiri kutoka kaunti ya Kericho na kutoka maeneo mengine humu nchini, ili tukufahamishe. Kikosi kiko tayari ili kuweza kukufahamisha hayo yote. Wanakwetu wananiita Joashon Sare. Endelea kuburudika na TV 47 katika vipindi, taarifa na burudani tele. Kwaheri kwa sasa.